This conference will now be recorded.
We will discuss all dermatology stations, including all the new stations. So any station that has appeared in plab 2 will be discussed today. Okay, before we start dermatology, before we start discussing the stations, what we're gonna do is I will put a structure. Okay, so I will put the structure for any dermatology case. Okay, when you go to the exam, I don't want you to be thinking. I don't want you to be thinking. All right, I want you to be exactly looking at your patient, concentrating with your patient, focusing on what he's saying. I don't want you to be thinking of the questions, what to ask next. So any dermatology case, what is the structure? If I have any patient with any skin lesion, what is my structure? My structure is the medicine. Do you think skin lesion is medicine or counseling? If a patient is coming with skin lesion, do you think is it medicine or counseling? Medicine. Guys, online doctors, can one person hear me? Can one person hear me? Perfect.
Medicine.
So if a patient is coming with a skin lesion, it is medicine structure, okay? But I will add some things. I will modify a bit in the structure, okay? So what is our medicine structure? If any patient is coming to you with a skin lesion, I will follow the structure P1, P2, P3, and maftosa. So P1, P2, P3, maftosa, and I'm sure everybody is fed up from this structure, yeah? But let's see what we're gonna change in this structure. P1, how can I help you? Doctor, I have a skin lesion. This is the structure, yeah? I have a skin lesion. Whatever, I have rash, I have spots, whatever the patient has. Okay, I have an ulcer. So this is the skin lesion. Whatever he gives me, the skin lesion, that's the presenting complaint. So right away, close your eyes, and don't even think about it. So you need to ask about the site. The site. Where is it? Doctor, in my foot, in my hand, on my face, for example. So the site. This is the fact. I will bring now a few questions here out of the presenting complaint. So number one question is the site. So where is it exactly? And every question will have a brother. Every question will have, what do you mean? So where is it? In my hand. Anywhere else? So where is it? The site. And the brother question, anywhere else? Okay. Since when? Doctor, for the past 2 months. Doctor, I've been having this skin lesion for a month. What made you come now? So the double, yeah? Every question has a brother. So since when? If the patient gives you long time, always ask him, what brought you now? Maybe there is something, there's a concern here. So since when? What brought you now? Okay. Anything else? What is the size of it? Every question has a brother. Any change in size? Since you have noticed it? Then what is the shape of it? The shape. Any change in the shape? So size, shape, color. What is the color of it? Any change in color? So double questions, yeah? Double questions. Site, anywhere else? Since when? What brought you now? Size, any change in size? Shape, any change in shape? Color, any change in color? Then, is it itchy? Is it bleeding? Any discharge? So is it itchy? Is it bleeding? Any discharge coming from the lesion? So is it itchy? Is it painful? Any bleeding? Any discharge? What is the final and the most important question? Any fever? So these are the questions that I will ask blindly. Don't even think about it. How can I help you? Doctor, I have a lesion in my genital area, for example, ulcer, for example. Don't say it's a new station. Dr. Mo, it's a new station. How can I deal with it? Where? Genital area. Side. Anywhere else? Since when? A month ago. Any specific concerns that brought you now? Size. Size of it. Change in size. Shape. Change. Color. Change. Is it itchy? Is it painful? Any bleeding? Any discharge? Any? Last question.
Fever.
Fever. Any fever. And whenever he gives you positive, what do you mean, Dr. Mo? Whenever he gives me positive. If he gives you positive thing, like, yes, doctor, there is discharge. Yes, doctor, there is discharge. What to do? What to do?
Track.
Explore. Track. Use the track to explore the discharge. We all know about track. I don't need to go into details. What is track? Track is timing, relation, amount, change in color or blood. So that's track. So whenever the patient gives you positive finding, always explore. That's all for the word skin lesion explore. P1. All these questions are in P1 already. Already, I have not moved anywhere in the structure, and I have already made some differentials. What do you mean, Dr. Mo? By asking about the fever, I excluded infection. By asking about the change in size, color, shape, I excluded cancer. So already I have made few differentials here. So this is the first thing. P1, skin lesion, all these questions. All right. After that, after I already asked about these questions, if the skin lesion, you know, P1, P2, P3 maftosa, okay? What is in maftosa? What is occupation and social? What is O and the S? O and the S. O for occupation, what do you do for living? And the S is for social. Who do you live with? How's things at home? Yes? So I will bring the occupation and social in the skin lesion early. What do you mean by early? What do you mean by early? The effect of the skin lesion on his life, on his daily activity, on his mood, I will bring it early, right after P1. Why? Because the patient will give me skin lesion that is chronic. For example, if the patient gives me skin lesion, okay, on his shoulder, on his face for about 3 months, I need to know the impact of the skin lesion on his life, on his mood, which we call it occupation and social. And also I need to ask about his job. So O and the S in maftosa. By the way, I'm being fast with the structure because I know you know the structure. I'm not talking to new doctors. I know you've been watching this for many hours. So in the dermatology, I will bring occupation and social early, right after presenting complaint. Why? Because I want to know the impact of the skin lesion on his life, on his daily activity. And also I need to ask about O and the S. What does O stand for? Job. You must ask about the job in skin lesion. You must ask about the job in skin lesion. I will tell you now in a bit why. So I will bring O and S later. Okay, but I told you now O and S in maftosa, I will have to bring them right after presenting complaint. Anyway, so P1 is finished. Then after P1, what is as per structure? After P1, what do we do after P1? We ask about the main concern. We ask about the main concern. What is after the main concern? Flows. Flow. Are you lost? Wow. This is our structure, yeah? This is day one structure. So our medicine structure is P1. After P1, ask about main concern. After main concern, ask about flows. After flows, P2, then P3, then maftosa. So after I finish the skin lesion, after I explore it, the questions, I will go to the concern. What's your main worry? What's your main concern? Doctor, I'm worried about cancer. Why are you always, if he said to you, I'm worried about cancer, why are you worried about cancer? He will give you a reason. Then after concern, I will put flows. I will ask flows. What is flows? Fever, lumps, bumps, lethargic, appetite, weight loss, night sweat. Is it important in dermatology? It is a must to exclude cancer, to ask flows. Okay. So P1, main concern, flows. And before I jump to P2, I will add a little thing because it's a new structure, because it's a new course. We need to give them something new. Does it make sense? Because it's new, we need to put something new. So right after flows, before I start P2, I will add STI. STI? Really? Really? STI? Yes, I will add STI. So I will add STI. STI. What does STI stand for? What is STI stand for? So I will add STI. What does STI stand for? What does STI stand for? STI stand for STI, right? STI, sexual transmitted infection, yeah? Yeah? Okay. STI stand for S for sun exposure, T for trauma, I for insect bite. That's STI. So STI, S for sun exposure, T for trauma, I for insect bite. You must ask STI right after flows and right after the presenting command. Why? Because it is a risk factor. It is what? A patient is coming with skin lesion. Very important to ask about trauma. Yes, trauma. Did he hear this area? Very important to ask about sun exposure, because sun exposure is a risk factor for skin lesions, and it is a risk factor that you must ask at any skin. Any skin problem, you must ask about what? Sun exposure. So STI. So, and I for insect bite, which again is a risk factor. So STI. So after STI, I will go to P2. What is P2? What is P2? P2, 2 questions, yeah? P2, past history of presenting complaint and past medical condition. So P2, 2 questions. Past history of presenting complaint. So I'll ask this patient, have you had this skin lesion before? The second question in P2, past medical condition. Past medical condition. And when I mention past medical conditions, what are the medical conditions I need to ask about? Guys, ask about COPD. Ask about any immune condition, because immune conditions, COPD, all these conditions, we give the patient steroids, and the steroids decreases the immunity and increases the risk of many skin lesions. Clear? So always you need to ask about any medical condition, and by that you need to specify what medical conditions. The immune condition, or the condition that for which this patient will be taking steroids, like what? Diabetes. Important again. Diabetes affect the immunities. Rheumatoid arthritis, yes, because we give the patient steroids and we give the patient many medications that decreases the immunity. So always in medical condition, ask about past medical history, ask about medical condition that is autoimmune, like CO, for example, like rheumatoid, and also ask about condition for which the patient may be given steroids. Okay, so past medical condition, past history of presenting complaint. What is P3? What is P3? P3 is DASA, plus or minus sexual history and IV drug abuse. So P3 is DASA plus or minus sexual history and IV drug abuse. Okay, DASA. What is the most important factor in DASA? Smoking. So DASA, diet, exercise, smoking, alcohol. What is the most important factor in DASA? Smoking. It is a risk factor for skin lesion, for skin cancer, and plus or minus sexual and IV. Is it important? Sexual, guys, it is a must. Sexual history is a must in any skin lesion. Write down. Sexual history, write down. It is a must at any skin lesion to ask sexual history. So sexual history is a must. Okay, and IV drug abuse. Dermatology. What does M stand for? M stand for medications. And by that, I will mean which medications? Steroids. Steroids. or infliximab and rituximab and alimab, Muhammad mab, all these medication that we give for rheumatoid arthritis and ankylosing spondylitis, all these medication that decreases the immunity, and then the patient is very susceptible to have skin lesions. Okay, so mainly fungal infections. So fungal infections, such patients, immune problem. So medications is a must. Allergy is important. Is allergy important in skin lesion? Oh my God, allergy is very important. Allergy is very important because urticaria and eczema and all these conditions, I must ask about allergy. What does F stand for? What is F? Family history. And if the skin condition is cancer, I need to ask about family history of skin cancer. Okay, so family history, is it important? Is a must. Family history is very important at any skin lesion. What does P stand for? Travel and contact. Write down. You cannot have a skin lesion without asking about travel and contact. So travel history and contact history. Travel and contact. Please, very important. Travel history and contact history. And when you ask about travel history, always make sure you ask him about travel outside UK. Don't ask him, have you traveled anywhere? Yes, doctor, I went from Liverpool to Manchester. It's a waste of question. It's a waste of time. Yes, doctor, I traveled to London. Yeah, it's a waste of, then I'm really sorry. I mean outside UK. So to save your time, when you ask about travel, always ask about travel history outside UK. What if the patient tells you, yes, I did travel to Egypt, or I traveled to Sudan, or I traveled to Zimbabwe? What will you do? What will you say? So when did you go? When did you come back? And were you sick by any chance over there? And if he said yes, I was, explore. So that's travel history. Okay. After my travel history is what? O and S. O is for occupation. So is it important? Is a must. Always ask about occupation and skin lesion because maybe the patient will be exposed to the sun exposure. So I'll always ask about occupation. Maftosa, occupation. Always ask the patient what you do for living. Social, who do you live with? And the impact of the skin problem on the daily activity, on the patient mood, it is always a must. So you must ask about the patient. If he said to you, doctor, I have this skin lesion on my face for about 6 months. Yeah. So for 6 months, the patient is having the skin lesion on his face. So you always need to ask him. 6 months sound quite long time. How is it affecting your mood? Is your mood okay? Do you feel all right? Yeah. So always, whenever the skin lesion is quite for a while, long time, always ask about the impact, the psychosocial impact. Okay. And finally, A is what? Maftosa. A for what? A. Anything else? A is anything else. So you always need to start a consultation with an open question. Skin lesion. Tell me more. Tell me more. And you always need to end your consultation with open question. Anything else you think it's important for me to know? So this is the skin structure. So skin structure. Quickly. How can I help you? Doctor, I have a skin lesion. Whatever lesion he tells you. Presenting complaint. Tell me more. What questions do you want? Site? Anywhere else? Since when? What brought you now? Shape, change in shape. Color, change in color. Size, change in size. Is it itchy? Is it painful? Any bleeding? Any discharge? Any fever? Imagine when you go to the exam with this mentality. With every branch you have a structure. Would you really think in front of the patient? Would you think and exhaust? No. At the door, in the cubicle, in the exam, at the door, you will look skin lesion. Done. Skin lesion. I will go to my patient, presenting complaint, site changes anywhere else, size, change in size, color, change in color, shape, change in shape. Is it itchy? Is it painful? Any bleeding? Any discharge? Any fever? Boom, finished. Step 1. Step 2 is concern. What's your main worry? What's your main concern? Boom. Finish. The step 3 is flows. Flows. So between P1 and P2, I have the concern and the flows and the new term, which is STI. So I will ask about the concern, I will ask about flows, and I'll ask about STI. What does STI stand for? Gonorrhea, chlamydia. Stand for S for sun exposure, T for trauma, I for, and then I will go to P2. P2, 2 questions. Have you had this problem before? The first question. And the second question in P2. P2 is past. Any medical condition. And by that, when there is a medical condition, always ask about chronic condition that affect the immune, like COPD, for example, rheumatoid, ankylosing. And P3. P3 is DESA, plus or minus sexual history and IV drug abuse. Okay, in DESA, diet, exercise, smoking, alcohol. What is the most important question? Smoking. Okay, diet is not really important. Diet is not really important. So smoking is important. Smoking. And then you go to sexual history and IV drug abuse. Is sexual history important? Yeah, it is important. Sexual history is important. So always ask sexual history. And then after that, you will go to maftosa, medication, allergy, family history, and T for travel. Always ask about travel and what? Contact history. Imagine if you have a skin lesion, and the skin lesion is always contagious. Mostly you must ask about contagious. Yeah. So contact history, and then occupation. What do you do for living? Because you want to know, is he exposed to the sun or not? And social, and you must ask about the psychosocial impact of the skin lesion on this person. Because we have a female, one of the stations, a female is coming because she has a mole. She has what? A mole. And she's going for her wedding. Why do you think they brought the case as a female? Why do you think they brought the case as a female? Because if the male has a mole, he doesn't care. The female cares about herself. There is a mole, the dress, my belly, yeah, my shoulders, my the male doesn't care. The male, he even, like, you know, he buys the suit, you know, an hour before for his wedding. Seriously, the male doesn't care mostly. So always they bring, or always skin lesions stations will be female. Why? Because the female is always having psychosocial impact of the problem on her mood. Like acne, do you think they will bring in the exam a case acne male? No, a male is, you know, it's fine. But a female, acne spot, one spot, she will have a birthday for the spot. That day will be a birthday. Like every year, it's that day, that time when I have seen this spot on my face. So then it's a female. Then psychosocial impact. Then it's very important to always ask psychosocial whenever you have any skin lesion. That's the structure. Let's start with every scenario, with every station, and with the structure. What the structure? Let's give you management structure. Let's give you management structure as well. Okay, in dermatology. After history, what comes after history? What comes after history? After history, examination, right? Yeah. After history, we examine. After history is what? Is examination. So write down examination. Okay. So please, in examination, you must mention number 1, observation. Write down. These are points I must mention at any skin lesion. Observation. What else? Skin lesion and lymph nodes. Observation, skin lesion, lymph nodes, and BMI. Especially if I'm suspecting BMI, if I'm suspecting cancer. So again, after history, what comes? What comes after history? What will we examine? What will we verbalize? Observation. What else?
Skin lesion.
The skin lesion itself, and at this point, giving a picture. So if you don't mention, I need to examine the lesion, you're not going to be giving anything. So observation, skin lesion. What else?
Lymph
nodes. What else? Finally, BMI if I'm suspecting
Why?
cancer. So always observation, skin lesion, lymph node, BMI. Imagine we have put this in the structure now. I have put this in a structures to make it and to add things and to modify. It takes time and effort in order for me to make something easy. So I've modified the structures and I added things. Why? Because lymph node. Imagine if you have a malignant skin lesion, for example, in the face, behind the ear, for example, and in the exam you don't mention that I will check the lymph nodes. And imagine if you do mention it. If you do mention it, I'm sure that you will be 1 out of 10. 10 doctors, how many will mention lymph nodes in a skin lesion? For example, if there is a lesion in the genital area, ulcer, how many of you will mention, I will look at the lesion and I will check the lymph nodes, the gland. So please mention observation, skin lesion, lymph node, BMI. That's an examination. Okay. Then after examination, provisional diagnosis, provisional diagnosis, provisional diagnosis, provisional diagnosis. It's your job. Yeah. What do you mean by your job? According to the lesion, you will give the diagnosis, which I will give you now as station by station. However, let me tell you something very important in the provisional diagnosis. What is the most important point I want to highlight and emphasize on a skin lesion in provisional diagnosis? Do not ever give cancer. Do not ever give cancer diagnosis to a patient on its own. What do you mean, Dr. Mo? The patient presented to the clinic. If a patient presented to the clinic, if a patient presented to the clinic and he gives you what? A skin lesion, changes, bleeding, discharge, very bad lesion, weight loss, everything, you still cannot give a diagnosis of cancer. That's my main advice in provisional diagnosis. Always best case scenario and worst case. Don't ever. But in the worst case scenario, you can say worst case scenario is cancer. Okay, Dr. Mo? Can you give us an example of provisional diagnosis? By the way, every station should take from me 3 minutes after this structure. This is like, I'm sure you can see, it's showing everything. I even extended my structure to involve the history, examination, diagnosis, management. Yeah. So in this dermatology structure, I said now we are talking about provisional diagnosis. What? Provisional diagnosis. I said my only advice, if you are suspecting skin cancer, do not give it on its own. Don't say, well, from the information you give me, I'm suspecting skin cancer. Imagine if it's not a skin cancer. Skin cancer diagnosis cannot be given unless you take biopsy. Imagine why, Dr. Mo, why in provisional diagnosis unless you take biopsy? Imagine, Dr. Sarmat, imagine if you give a patient a provisional diagnosis of cancer. You told the patient, well, I'm suspecting cancer, and you have not taken any biopsy yet, and I'll urgently refer you 2 weeks referral to dermatologist. Then he will be referred in 2 weeks. Imagine in these 2 weeks, how will his life be? Imagine if I give you diagnosis of cancer. I give you diagnosis of cancer, and I tell you 2 weeks referral. How would your life be in these 2 weeks until you are referred?
I will not study that.
You will not do anything. Yes, you will stop everything, and you will start thinking, okay, now, I have 10,000 pounds. I'm gonna die now, so I will spend them on a charity. I'm gonna die. Nothing will benefit me anymore. And they will start spending your money on a charity, and then if you are married or if you have a partner, you will tell her, after I die, don't marry and don't get with anybody else, please. Do you love me? And then you will ring your family. It will be miserable life. And then you will pray. You will pray all day, 24/7, till you go for the referral. You're gonna die. Anyway, it is very devastating. Then he goes to the specialist, and the specialist take biopsy and tells them, well, it's not cancer. It's not cancer. It is. It looks like, but it's not cancer. Oh my! He will sue you. He will be miserable for 2 weeks, and maybe he will like lose weight, and and then he will tell himself, I'm losing weight because I'm having cancer, but he's losing weight because he's stressed out. Anyway, so my only advice in provisional diagnosis, do not ever give the word cancer on its own. Give it, but with best case scenario and worst case scenario. Okay, another advice when you give provisional diagnosis, which nobody does, and I read it in all scripts. Obviously, to teach plab 2, I had to read everybody else's scripts, and I had to make my own thing. You need to know what's there in order to be exotic, right? You need to. So everybody in all the scripts, whenever they give provisional diagnosis, that's what they say. Well, from the information you're giving me and according to my examination, best case scenario is this, worst case scenario is this. It is the worst ever way to give provisional diagnosis. What do you mean, Dr. Mo? The main concern in plab 2 is patient-centered. The patient needs to understand what's happening, right? So whenever you give provisional diagnosis, always recap the positive. What? Recap what? The positive. What do you mean, Dr. Mo? Whenever I'm giving a provisional diagnosis, for example, I'm telling you now, don't be lost. I'm teaching you how to give the best way. Okay. While you are taking history, you found that this lesion is changing in color. You found that this lesion is bleeding. You found that this lesion is having discharge, the smelly. And you found that the lesion is increasing in size. These were positive findings during history. Then when you reach a provisional diagnosis, now you are suspecting melanoma. It could be infection, it could be melanoma. Best case, worst case. Guys, everyone, and when I say everyone, I mean everyone. Because you read the script so much to the level that everyone will tell me like this. Well, from the information you're giving me and according to the examination, when you examined the patient, for example, you found lymph nodes in the neck, you found weight loss, for example. So you tell the patient, from the information you're giving me and according to the examination, best case scenario infection, worst case scenario is cancer. So the patient is asking himself, okay, from the information I gave you, which information exactly? Okay, and according to your examination, what did you find? The patient does not understand. So look at the way I'm gonna give the provisional diagnosis. I will say, well, Mr. Andrew, from the information you have given me, you have told me, and then I will start recapping. Recapping what? The positive. Well, from the information you have told me, you have mentioned that you have a skin lesion behind your ears. It's increasing in size, and it is black in color, and it is discharging smelly offensive discharge. Am I right? Yes, doctor. And according to my examination, I found lymph node enlargement. Yes, doctor. Well, best case scenario, it could be skin infection. However, I'm sorry to come across that way, but I am very concerned. Why are you concerned? Because it's changing in size and color and shape. Discharge, but I'm very concerned. The fact that this skin lesion is changing in color and size and discharge is making me concerned. That's why I would like to exclude, not to confirm, not to confirm cancer, to exclude what we call it worst case scenario, like what? Skin cancer. So, and then start talking about management. Online doctors, are you following?
Yes, very nice. Thank you.
So how many of you will do the provisional diagnosis like this? None. Everybody will go from the information you're giving me and according to my examination, best case scenario, where is the patient centered here? Okay, what information he's giving you? Yes, he's giving you information, but does he know the warning signs for cancer? But you know, and it's patient centered. Then this patient, the first patient that we told him, well, from the information you're giving me and according to my examination, I'm suspecting best case scenario infection, worst case scenario cancer. When he goes home and his girlfriend sees him and she tells him, Andrew, what happened, Andrew? Well, the doctor wants to exclude cancer. But why Andrew? Now, Andrew needs to understand. Well, from the information I give him and according to his examination, he is suspecting cancer. And that's it. That's what Andrew knows. But Andrew, in the second scenario, when he goes to his girlfriend and she tells him, what happened, Andrew? He will tell her, look, the doctor is suspecting he wants to exclude cancer. Why? Why, Andrew? Well, you know, because the skin lesion is bigger in size and the skin lesion is bleeding and there is discharge and it's changing color. And when he examined me, he found the lymph nodes. That's why he's suspecting that, or he wants to exclude what? So in the second scenario, he knows what's happening. In the first scenario, he doesn't know. But unfortunately, 99% of the doctors, it's not unfortunately, it's good, because that will make you exotic. If you do it that way, you will be exotic. So that's the way you give provisional diagnosis. Finally, I will talk about what after provisional diagnosis is what? Management. So I have also made a small structure for you in management, yeah? And in this structure, I have highlighted the main points, okay? Okay, that structure that we have, how many steps we have in our structure? The medicine structure. Our medicine structure, how many? How many steps? You remember?
7.
7 steps. Perfect. 7 steps. So now I have made a structure which I will apply the dermatology on the 7 steps. So step 1, I will tell you, step 1, don't forget urgent referral if it's a cancer. That's it. You remember step 1? Step 1 is either admit or send to home or refer. So I will tell you, don't forget in step 1, if it's a cancer, do what? Urgent referral, within 2 weeks to dermatologist. Step 2 is senior. So step 2 is senior. Step 2 is senior. Step 3 is what? Investigation. Write down. Investigations. All the dermatology, I will do blood. All dermatology, I will do. All dermatology, I will do blood. If I'm suspecting syphilis, guys, I'm giving you a structure for all derma. So all derma, I will do. Number 2, if I'm suspecting HIV, like weight loss, lymphadenopathy, I will do stress screening. If I'm suspecting syphilis, stress screening. If it's fungal, scrabbing, skin scrabbing. If it's a cancer, skin biopsy. Online doctors, are you following? So,
Yes, doctor.
this is structure for all dermatology. So, step 1, we said referral, urgent if it's a cancer. Step 2, senior. Step 3, investigation. I said all derma. One thing I will do, blood. But if I'm suspecting a fungal infection, skin scrabbing. If I'm suspecting cancer, biopsy. If I'm suspecting something to do with STI, HIV, syphilis, I'll do STI screening. Now, what is step 4? What is step 4? Symptomatic and lifestyle. In this step, you must talk about DASA. You must talk about DASA. What is DASA? If there is a lifestyle that needs changing, like smoking, you must talk about DASA in step 4, and you must mention sun exposure in step 4. Lifestyle. If the patient is exposed to the sun, you must talk about sun. That's in step 4, lifestyle, smoking, and sun exposure. You remember sun exposure in the history? It was part of what? STI. Okay? Don't ever forget sun in skin. What is the first letter in skin? S. First letter in sun? S. Skin, sun. Always skin, sun. Don't ever forget. It's either in the sun, skin, or STI, anything. I've given you plenty of things, sorry. Always sun. Okay. What is step 5? Step 5 in the structure? Specialist. Step 5 is specialist. So who you refer to? Dermatology. We know that, yeah? So step 5 is dermatology specialist all the time. Okay. If it's a skin cancer, he will do the biopsy. If it's a fungal, he will do skin scrabbing. Okay. And if it's a benign, he will manage it either by laser or by freezing. Okay. So that's step 5. Don't worry, I will talk about management later in every station, but this is a rigid structure for you to follow. I've taken my time in the structure, but the station is not going to take time from us. Okay. And finally, safety netting. Finally, is write down in safety netting. Write down in safety netting. Safety netting. A, B, C, D. A, B, C, D. A, B, C, D. That's one thing in safety netting. What else in safety netting? Write down metastasis. So how many points in safety netting I give you now? Either A, B, C, D, or what do you mean either or? What do you mean either or? Online doctors, are you lost?
No, doctor.
No, doctor.
Okay, so safety netting is either or, either A, B, C, D, or metastasis. If the patient is coming with benign lesion, with what? Benign, I will safety net him for A, B, C, D. What do you mean? If the patient is coming with benign lesion, I will safety net him for A, B, C, D. A, asymmetry. B, border. C, color, border or bleeding. C, color. D, discharge. What do you mean? If the patient is coming with benign lesion, is there any changes in the benign lesion? No. So I will safety net him for changes. If there are changes, come right away, which means any change in asymmetry, bleeding, color, discharge. Clear, guys? Clear. So if the patient is coming with benign lesion, my safety rating is A, B, C, D, E, or metastasis? A, B, C, D. A, B, C, D. But if the patient is coming with skin cancer, if I'm suspecting skin cancer, I will safety net him for A, B, C, D. Is already changing in color. The skin lesion is already changing in size. The skin lesion is bleeding. Imagine if I tell him, if there is any change in color or bleeding or discharge, come right away. He will always tell you, doctor, he will assess your cognition. The patient will assess the doctor's cognition. Doctor, do you know where we are? Doctor, do you know who brought you here? Doctor, the skin lesion is discharging anyway, and the skin lesion is changing in color. So he will assess your cognition. So to avoid the patient assessing your cognition and asking you for confusion questions, if the skin lesion is already suspicion of cancer, your safety netting is going to be metastasis. If there's any lumps in your body, lumps or bumps in your body, if you feel any new lesions, come right away, because it's already ABCD. So you will safety net him for metastasis. Online doctors, are you okay? So this is the structure. We have taken long time in the structure, but let's start the stations. Okay. And when you start the stations, every station should take from me maximum 3-4 minutes, maximum, if that. Okay. Because nothing will leave the structure. Okay. Nothing. So how many safety rating we've given now? How many safety rating we've given? To put one more. So the first safety rating is 4 if the skin lesion is benign. My safety rating is A, B, C, D. The second skin lesion, if the skin lesion, the second safety rating, if the skin lesion is cancer, are you gonna safety for A, B, C, D? No, you're gonna safety net for metastasis, any lumps, any bumps, any new skin lesion. Okay. The third safety netting is contact. Write down contact. Contact. Write down. The third point in safety netting is contact. What do you mean by that? Fungal infection. Fungal. You're gonna talk about contact because fungal is contagious. So you will ask the patient, you will tell him do and don't. I will tell you later what's do and don't, but just write it down now because that is a structure to cover all management. So how many points in safety netting now? Safety netting, 3 points. If the skin lesion is benign, A, B, C, D. If the skin lesion is, by the way, I said A, B, C, D and add E. A, B, C, D, E. يلا بقى ما هو free. Free. Write down A, B, C, D, E. What is A? Asymmetry. What is B? Bleeding. What is C? Dr. Lord, switch off your camera. What is C? Change in color. What is D? D is discharge, and E, exposure to the sun. Sun exposure. You need to safety net him. Don't be exposed to the sun. Am I making sense or not? Yes. You will tell him, don't expose to the sun. You see, when you create the structure, you just like make it كده as you are sitting. It's irtigal. What is irtigal? Last time the doctor said, huh? vasodilatation. So, if the skin lesion is cancerous, what is my safety netting? Can I say to the patient if there is any change in color and size and discharge? No, it is already changing. It is already discharging. So my safety netting, if there is any lumps, bumps, if there's any, yeah, new skin lesions anywhere. Finally, if it's a fungal infection, what to do? If it's a fungal infection, always talk about contact, do and don't. Now let's start, and when we start, we'll go a bit in details of every station. Okay, and we'll focus in few things. Okay, let's start. Online doctors, ready?
Yes, doctor.
Okay, don't worry because you have the notes. Okay, you have the notes. You already have the notes, guys, on the drive. So the station, if I go quick, don't worry because you have the structure. Even the structure I've given, it is in the notes, and in the notes you have the pictures, you have everything. So if I go quick, don't worry, you don't even need to write down anything. Okay, first station, write down urticaria. First station, urticaria. You are an FY2 doctor in the, by the way, I will follow my structure. Nothing outside the structure, yeah? You are an FY2 doctor in the GP clinic. A mother of 5-year-old Tom has got some concerns. Okay, doctors, what I'm going to do now, do you think I will repeat the structure over and over again in every station? No. I will give you only the positive findings. Online doctors, do you understand me? I will only give you the positive findings. Only positive. Why? Because you will go through the structure. And what will be positive? 1, 2, 3, 4. That's it. Okay? So, urticaria is the first case. 5 years old, was brought by his mom because she is concerned. Okay. What are the positive findings in this case? The positive finding in this case, the mother is coming because he has a skin lesion. Skin lesion. It is red, patches, raised over the skin, or raised spots. By the way, online doctors, I will give you an advice. Are you all listening? Are you all listening?
Yes.
I will give
Yes,
you an
doctor.
advice. The best way to study dermatology. What is the best way to study dermatology? Is to open the picture in Google. Look at the shape of, look at how it looks. It will be stuck to your head. Don't just study like raise the patches, raise the spots. No. Urticaria. Google urticaria picture. Like I brought the pictures that comes in the exam. I put here the pictures that you will have in the exam. These are copy and paste of the pictures. In every skin lesion, I have put the pictures that you will be given in the exam, yeah? But if you don't have the notes, what to do? What to do if you don't have the notes?
Open the lead.
No, look for
Picture.
the notes. Look for the notes. Anyway, so the picture, do not study dermatology without pictures, please. Always Google, because while I'm talking now, I know the shit. I know how it looks. But if I give you just talk, it's gonna be confusing, okay? So always look at the pictures in dermatology. So positive finding, she will tell you patches, red patches raised on top of the skin, sometimes spots, different size, and she will tell you it appears always when he does exercise, always appears when she will give you this description, always appears when I'm giving him hot bath. When I'm giving him hot bath, hot water, hot bath, okay? So is it infectious or not? Is urticaria infectious or not?
No.
It is not, okay? The rash is often itchy. The rash is often itchy, and sometimes it gives, the child give you, it's burning, okay? The duration, what are the durations? And the symptoms will resolve within. The symptoms will resolve within days, and sometimes after a few hours or days, the symptoms will resolve. This is urticaria, very important, okay? What are the triggers? These are the positive finding. Online doctors, Dr. Nihal,
Yes, doctor.
I always tell you in the online course, Why do we take history? Why do we take history? To reach the diagnosis only, or why?
To be addressing the risk factors, addressing the risk factors and the complications.
Perfect. So whenever you take history, tell yourself, I take history to reach the diagnosis only or not? No, I want to reach the diagnosis and I want to know the cause, because the first question the patient relative will ask me, what is the first question they will ask? Why? Why is he having this? Why means the cause. And if you don't ask about the cause, you're not going to be able to answer. You'll tell, sorry, I forgot to ask about the risk factor. Can I ask you a few questions? I'm really sorry about that. Then you will look not good, yeah? So the risk factors here, the triggers, ask here about any certain food that he has and this appears, for example. For example, any certain food, any plants, he get in contact with any plants, any animals, just before the rash. Just before the rash, what was he doing? Random, beautiful, open question. Just before the rash, what was he doing? Doctor who's eating something, doctor who's in contact with animal, with cat, with whatever, she will tell you. Okay? Doctor who's giving the medication, she will tell you. So the best question to ask here about risk factor, just before the rash, what was he doing? Was he given anything? What was he doing? Okay? Management. What is the management? What is the management, guys? Okay, we know the steps, we know how we follow the steps, but in the management here, always give her an advice about avoiding that. Wallahi, if you manage the itchy rash without talking about the risk factor, you're not going to pass the station. Why you're not going to pass the station? Because he will keep having the same risk.
Because it's going to happen again.
It's going to happen again. So always talk about the triggers. Always talk about the triggers is very important. Okay? Then give symptomatic treatment. Symptomatic treatment as simple as medication for the itchiness. He's itching, yeah? Medication for the itchiness. Okay? Antihistamine, calamine lotion. Okay? So calamine lotion, antihistamine. So medication for the itchiness, yeah? So antihistamine, calamine lotion, and always advise about the risk factor. Okay? So do we refer here? I don't refer. However, I will say to her, if it's getting painful, if it doesn't go away after avoiding the risk factor and the treatment, the medication, come right away. Clear? Because you will need what? Referral. So when do we refer? When do we refer? If it's painful, if it doesn't go away after treatment and after avoiding the risk factor, you will need referral. Second station, is it difficult? Is the way easy and quick, or there is no need for me to go through the structure? Online doctors.
Yes.
How to apply the structure? Simply. Assalamu alaikum. Alaikum assalam. How can I help you? She will tell you. The first station, yeah? Doctor, my son is having rash. What is the thing that whenever a child is having rash, you must exclude? Meningitis. Online doctors, what is the thing that we must exclude? Is it covered in the structure? Meningitis. Is it covered in the structure?
Yes.
Where?
Yes.
Infection.
Fever.
So how to apply the structure in the first case? So you will be familiar with it. How can I help you, doctor? My son has rash. Site, anywhere else, size, shape, change, color, discharge, itchy, painful. She will tell you it's itchy, and she will tell you it's red, and she'll give a description. That's it. That's how to apply the questions. Painful, no. Itchy, yes. Discharge, no. Bleeding, no. Any fever, no. That's it. Structure. Then you will go with the rest of the questions. You will pick what you want. Child 5 years old, you ask about smoking?
Why not?
Huh? طلاب يسابلس ده ولا ايه؟ لا. Next station, chicken pox. You are an FY2 doctor in the GB clinic. Sally brought her daughter. ما شاء الله. The mother is named Sally. الله العظيم. Beautiful name, huh? For a mother to be called Sally. يعني. What about the daughter? The daughter, Jessica. You see? طبعا ما هو Sally should have Jessica. Sally cannot have Amina مثلا ولا. Sally, Jessica. So Sally brought her daughter, Jessica, again 5 years old. She developed rash. Talk to her, address her concern. So the second station presenting complaint is rash. What if I don't know the station? It's a chicken box station, yeah? I don't know the station, new station. How can I start? New station, site, since when, size, any change in size, color, change in color, shape, change in shape. Is it itchy? Is it painful? Any bleeding? Any discharge? Any fever? Finished. She will give you, sorry?
Move to the
No, seriously. You see how easy? You see how easy it will make you structured. Anyway, so in this case, it's a chicken box case. What are the positive findings? That's all what you need. The positive findings: temperature. The child, generally, she's saying, doctor, he's not himself. So feeling unwell. Doctor, he's not eating as he used to. His appetite. Doctor, it's itchy. And she will give you the description of the chicken box, vesicles, doctor, and it's like full of fluid. That's it. This is the positive findings. So the positive findings again: temperature, not himself. Yeah, aching, not himself. Okay. She will tell you, doctor, he's not eating well because he's sick. Yeah. And she will tell you it's itchy. And when you ask her, can you describe it for me? Doctor, it's like vesicles full of fluids. That's it. Where is it? In the trunk, in the body? She will give you the description. Okay. Follow the structure as it is. Follow the structure as it is. When you reach examination, you will ask for to examine the skin lesion, and the observation will be giving a picture, and this is the picture. This is the picture. Okay. Now, make sure when you ask her about the rash, ask her, is it crusted or not? Is it crusted or is it oozing? Is it crusted? Is it important to ask this question? Yes, because once it's crusted, it's not infectious anymore. Once it is crusted, it's not infectious anymore. So always ask this question, yeah? Now, any other questions you need to ask? Always, because it's infectious, ask anybody else is sick at home. Always ask about anybody else is sick at home. Very important. Okay, you examined, you have given her the provisional diagnosis. Now jump to management. What is the management? How to manage this case? What is the management, guys? The management is what? Do you give antibiotics?
No.
Do you give antifungal?
No.
Guys, symptomatic treatment, supportive treatment. Okay, but don't forget, in the history, follow the structure, because you don't want to miss what? Meningitis. Because meningitis, you ask about fever, and he has fever. So always ask about shy away from light. Okay, vomiting. Ask about stiffness in the neck. He's 5 years old. Yes, he will say stiffness. He's not 1 year or a year old where he doesn't know, or we cannot ask stiffness. No, he knows 5, 6 years old. So please exclude meningitis. Yeah. Okay. Anyway, treatment, symptomatic treatment. That's it. So symptomatic treatment, but follow the structure. So symptomatic treatment, paracetamol, calpol. So symptomatic treatments, okay, paracetamol, okay, calpol, plenty of fluids. Ask her to give him plenty of fluids. Antihistamine, can you give? Yeah, it's itching. Antihistamine, yes, antihistamine, it's itching, okay. And very important, this child, things that you will tell her, do and don't. Do and don't is always important. And online doctors, in my notes, it's always NHS management. Please do not look anywhere. Do not look anywhere. If you compare my management in my notes with the NHS, if you see something missing and it's not as per the NHS, okay, I will give you the course for free. The new notes as per the NHS, seriously, because you don't need to exhaust yourself. This is the NHS management. That's it. NHS copy paste. Okay. So the management, things that you do and things that you don't do, which we said, plenty of fluids. Do cut his nails. Why? Why cut his nails?
Scratch.
Because he will scratch. Give him a glove. Put his hand in a glove. Yeah. Because you don't want him to scratch. Okay. Things that you don't give him aspirin if he's under 16. Okay. And don't make him around newborn or pregnant ladies, because you don't want the pregnant lady to be sick. Okay. Safety netting. So by any chance, Can you ask the mother, are you pregnant?
If you get pregnant.
No, I mean, his mom is coming, bringing him or ringing.
Yeah, why not?
Can you ask about pregnancy? Yes, she
We
may be
have
pregnant.
to. We have to.
And
Yeah.
if you don't, you'll fail. Seriously. Imagine if you don't and his mom is pregnant. Write down. Imagine if his mom is pregnant and you don't ask. Guys, online doctors, if his mom is pregnant and you don't ask, what's gonna happen?
She's gonna get it.
You will fail.
Get infected.
No. A week later in the GMC, they will bring medical error station.
syndrome.
No. A week later, they will bring medical error station. Go and speak to a lady who's pregnant and she brought her son who's got chicken pox, and your colleague who just passed the plab 2 did not ask about P4 pregnancy. And then you, I'm really sorry, you know, my colleague. Why? So ask. Okay, so it will be medical error station. Anyway, next station, scabies, and that's how it looks. Yeah, that's how scabies look. Okay, scabies. Again, you are an FY2 doctor, a mother of Michelle that is 3 years old. She brought her with a complaint. Talk to her and this is a concern. What are the presenting complaints? She's bringing here with what? Itchiness, especially at night. Raised, elevated rash. So itchiness, especially at night. Raised, elevated rash. One of the doctors said, what is the safety netting for chicken pox? Safety netting for chicken pox, if it's not improving, if it's getting worse, okay? If the spots are not crusted, if the child is not improving, that's the safety netting, yeah? Okay? And safety netting, if it's infectious, I said, don't make him contact with who? With pregnant, and if he goes to school, stop at least for this few days until it's crusted. Anyway, back to the scabies. So scabies, what is the presenting complaint? Positive findings. Itchy, especially at night, and he will come with a skin lesion that is between his fingers webs here, yeah? Okay, and it's elevated skin lesion, okay? And the hand is most common affected. That's it. Anything else? No. That's it. You will carry on with the history. Dr. Mo, you give us a structure. You don't need to repeat to Dr. Mo. Don't repeat yourself. What do you mean, brother? Don't repeat yourself. The lady will bring the child. She will say he's got this kind of rash. I will ask site, since when, size, change in size, shape, change in shape, color, discharge, itchy, bleeding, painful, fever. Same questions. Okay? Same history. And then you will come to examination. You will examine the skin lesion and the observation. You will be giving what? Picture. You will be giving picture, okay? And the picture, it will be under the magnifying glass, the magnifying lens, okay? Because there is something called burrs. Burrs is like ways of, lines, and this will be seen with the magnifying lens, and you'll be given pictures that you will not mix it with anything else. And with the description I give you, it is scabies. Okay. So management. What is the management? How to manage? How to manage?
7 steps
Sorry?
again.
Symptomatic.
Symptomatic treatment. The most important question in plab 1. You remember plab 1? What do you give? You give permethrin cream, yeah?
Yeah, 0.5.
Yes, permethrin cream. Write down permethrin cream, yeah? Okay. But if the child is having an allergy, second line to permethrin cream, you give malathion liquid, MALATHION. In Egyptian accent, malathion liquid. Okay, TH, yeah? So permethrin, first line. But more important than giving permethrin, if the child is itchy, what are you gonna give? If the child is itchy, what are you gonna give?
Antihistamine.
You give antihistamine, emollient, oral antihistamine. You can even give hydrocortisone cream if it's severe itchiness. So antihistamine, emollient, and you can go further to hydrocortisone cream. So now the management, can you please tell me? Number one, you will give no before antihistamine,
Permethrin.
permethrin. If the child is having any problem with permethrin,
Malathion.
and then you give symptomatic antihistamine, starting with antihistamine and the emollient, and you can even give him hydrocortisone cream. But more important than this, you should advise about
Contact.
Yes,
Contact
you should
stress.
advise. Okay, you should advise things do and don't. Do and don't. His clothes needs to be washed and not in contact with, and the bed sheets. Okay, so clothes, underwear, bed sheets, everything needs to be cleaned, changed, and cleaned with hot water. Okay, okay. And don't is the opposite of do. What is don't? Don't is the opposite of do. So do not make him in contact with other children, other people. So do and don't. So the management always in dermatology, don't forget do and don't. So in this case, management is clear. Okay, will you repeat the medication, guys? Will you repeat the medicine? Will you repeat it? Yes, it will need to be repeated
Excuse me,
after.
doctor.
Yes.
Shall we mention that we have to treat all the family members who's in contact?
Yes, doctor. Guys, I'm really sorry. I said no questions. Sorry, doctor, because if I answer one, I will know.
Sorry.
Yeah, I have not finished. I have not reached my safety netting. I have not reached my safety netting. I'm so far talking about the management of the child. Safety netting comes later or comes. Safety netting is the last step. Yeah. So far, I'm talking about the child itself. So the child himself, don't forget the medication, the antihistamine, the permethrin, and then you go to do and don't. Do and don't. Do and don't. The washing, the cleaning, very important. Contact. Write down. In this station, if you don't talk about contact, you're not gonna pass the station. Okay. So coming back to safety netting. Okay. I ask the question: for how long the treatment? For 1 week or more?
1 week later,
So after
we have to repeat it.
Yes, a week
1
later we
week.
have to repeat it. Yeah. A week later we have to repeat the medication. Okay. Now, safety netting. Okay. Safety netting. Number one, that everybody else at home needs to be treated. Everything at home needs to be changed, washed. Okay. And in safety netting, if he is not improving 2 to 3 weeks, come back. Herpes zoster. Next station, herpes zoster. You know, in order to see this burrow, they put something which is ink. Yeah, they put what? Ink burrow test. It's called the ink burrow test. They put in order to see the lines. Okay. Anyway, next, herpes zoster. Herpes zoster, guys, is a presenting complaint of a patient who's coming with severe pain, usually in the chest, on the chest. So write down FY to doctor in the GB clinic. Peter presented to the clinic with chest pain. So what is the presenting complaint? Chest pain. Okay. Do you know the chest pain structure? Do you know chest pain structure?
Yes.
Yes, we know. So I don't need to go into the chest pain structure. Okay. If a patient is coming with chest pain, when you ask about the chest pain, he will tell you, doctor, there is a rash on my skin. I feel chest pain, tingling sensation, painful, burning. That's the description. Tingling, painful, burning, chest pain. Can I tell you something? If a patient comes to the clinic or to the hospital with herpes zoster, shingles, it's called what? shingles. If the shingles are in the left side, please do ECG. Yeah, please. Again, if a patient comes to the A&E, the patient comes to the hospital. Online doctors, can you hear me?
Yes.
Yes, doctor.
With any pain, any what? Pain, chest pain on the left side, always do ECG. If a patient said to you, doctor, I was playing squash yesterday, and you know I haven't been playing squash for a while. I haven't been playing squash for 5 years, and yesterday was the first time after 5 years. And he said to you, I was playing squash, okay, or heavy lifting, whatever. Is it muscular or heart attack? But if the pain is in the left side, you must do ECG. Clear, clear.
Yes,
ECG, ECG. If it's on the right side, it's fine, no problem. Right side, skin lesion, everything, pain, muscular. If you don't, it will be okay. But in the left side, you must, okay? In the hospital, in UK, in the NHS, if you go to a patient and the patient is saying, I have burning sensation. I have what? Burning sensation. And I have been suffering of GERD. And I am on omeprazole. You must do.
ECG.
Don't ask me why, don't ask me how, but ECG. If the senior comes and, have you done ECG? No, doctor, I haven't, because, you know, she's having GERD and she's having the GERD, and, you know, it's not, you know, he will not be happy. Okay, so chicken pox, so herpes zoster shingles, the patient is presenting with tingling, painful skin lesion. Okay, he will describe it as rash on the chest. Okay, now that's the presenting complaint. That's how it looks, guys. Can you see? That's how it looks. Okay,
Yes.
everything else. Okay, do you need to ask about the chicken pox? You need to ask about the chicken pox.
Yes.
You
Yes.
need to ask about the chicken pox, if he's had what? Chicken pox or not. Okay, very important, very important. Do you need to ask about fever?
Yes.
It's in the structure. It's in the structure. Yes, you need to. Okay, now management. What is the management? Examination. I showed you the picture. All what you need to say, observation and examine the skin. Boom, shakush, shakush. They will give you the picture. Then you see the picture. After you see the picture, what to do? After you see the picture, what to do?
Verbalizes.
After you see the picture,
Provisional
always
diagnosis.
no, no. After you see the picture, always tell the patient the description of the picture, which what we call it in the day one structure. Whenever you get given findings, always tell the patient, yes, we have found such and such lesion. Yes, it's such and such. Please tell the patient. Patient-centered. Please tell the patient the description of anything, if any examination are given. Anyway, management again. Management again. In the management of this patient, what is the first thing? He's coming with pain, severe pain. What is the first thing you give?
Painkiller.
Painkiller, guys. Like what? Paracetamol or diclofenac?
Gabapentin.
Nerve painkiller, because that's nerve. That's what? Nerve painkiller. Okay, so we'll give gabapentin. Okay, so nerve painkiller, yeah. Gabapentin, amitriptyline, they give it sometimes. So gabapentin, amitriptyline, all of them. Okay, and you will give antiretroviral medication. Sorry, antiviral medication. Retroviral is HIV. Antiviral medication. Okay, what medication do you give? Acyclovir, famciclovir, Muhammad cyclovir, Ali cyclovir, any cyclovir. Okay, now always when to ask the patient, it's very important. The antiviral medication is most useful when it starts as early as you can. within 72 hours of the rash appearing. So very important to tell the patient that he needs to start it, guys, as soon as possible, because it leaves terrible, yeah, terrible problems if it's not treated as soon as possible. So what is the treatment? Number one, what is the painkiller? Gabapentin. Number two, you will give him antiviral medication, acyclovir, ganciclovir. Number three, you must tell him that the medication should be started
within 72 hours as soon as possible.
Because it should be managed earlier. Okay, be careful, because in this station, listen carefully, in this station, do you remember I said to you in the main structure, I said to you be careful because P2 is very important in some cases. What was P2?
Any medical condition,
any medical condition, anything that affects his immunity. Yeah. So these cases will be mostly elderly, diabetic, or elderly patient who are on medication, like, for example, they have rheumatoid, and they're using infliximab, they're using steroids all the time. Remember this word. So always ask, because if you leave the station without knowing that yes, he's immunocompromised, it will be a problem. So one of them is the shingles. It will be usually elderly diabetic or elderly patient who are on medication. Okay.
Oh.
And do and don't all the time. Do and don't. Do and don't. What is do and don't? Do and don't, because there is a rash. This patient, can he wear tight clothes? No. Loose clothes. Loose clothes. Okay. And they can put the cream and loose clothes on top. So tight clothes, no, not allowed. Yeah. And they can use cool compresses. Do. Don't, which is the opposite. Don't put plaster, yeah, on the rash. Don't put tight clothes on the rash. Okay. Don't use antibiotic creams. Okay. Because it causes slow healing. So you don't give antibiotics here. Okay. So NHS website, the NHS website, when I was preparing my new notes, the management notes that is on the drive for all of you, it's only NHS. I did not bring anything anywhere else, just NHS. They focus on do and don't, very important. Do and don't, do and don't, do and don't. More important, they focus on the non-medical than the medical. Guys, are you following me? They focus on the non-medical more than the medical. Avoid contact, wash the clothes, you know, with all the skin lesion, always, please, the do and don't is very important. You are not managing with just medication. Okay. Safety netting. Safety netting. Safety netting. What is safety netting? Safety netting. Avoid pregnant ladies. You remember, I said to you that it comes to who? Immunocompromised. So, صلى على النبي. Avoid the immunocompromised. Avoid the pregnant, avoid the elderly, avoid the babies, neonate. So it comes to immunocompromised and safety netting. Avoid what? Immunocompromised. Okay, so avoid immunocompromised, and it affects immunocompromised here. So little thing, have you noticed? I focus on little things. Little things, yeah. So medical condition is important here. Patients will be immunocompromised. When you safety net, avoid immunocompromised, yeah. Okay.
Dr. Mo?
Yes.
I have one question. Does the FI2 can prescribe the acyclovir
Yes,
in
doctor.
the GP setting?
Yes.
Okay.
Why? Why do I say yes? Because we are having a senior, always senior. And who's my senior in the GP? Consultant, GP consultant. So, okay, so we do give acyclovir, yes, in the GP clinic. We do give a steroid, yes, in the GP clinic. Okay, okay. So herpes labialis, okay. So this is the herpes labialis. Okay, that is the picture that will be given, right? Okay, you are an FY2 doctor in the GP clinic, 24 years old, Alicia Keys. She presented with rash on her lips, on her lower lip. Okay, she's concerned about it. Okay, so again, same presentation, same structure. How can I help you? Presenting complaint. The patient will give you skin lesion always. Since when? Site, anywhere else, size, change in size, color, change in color, same presentation. Clear, guys? Same skin structure. But what is the positive here? The positive here, tingling, burning sensation, itchiness in the lip. That's it. So the presenting complaint, burning, tingling, itchiness in the lip. Okay? Okay. When you take history from her, okay, she can give you risk factor. I said there are some triggers. She can give you some triggers, sometimes, not all the time. Okay? Like what? Like another illness, like she had flu-like symptoms. Okay? So they can give you that, yes, doctor, I've been unwell for about 1 week. I've had sore throat. So they will give you a history of being unwell. Okay? And they can give you a history of being unwell, and they can be worse with the sun. Okay, sun exposure makes it worse, so be careful from these things. Okay, do you forget sun anyway? Sun is everywhere. Sun is a part of STI. Okay. Now we have seen the picture, and I've put few pictures. Yeah, I have put like 2-3 pictures. Okay, so presenting complaint. On examination, what to do? Observation and skin lesion, and if there's any lymph nodes. Okay, observation, skin lesion, lymph node. Okay, is lymph nodes important? Yes. This for anyone can look like basal cell carcinoma, for example. So yes, lymph node observation, everything. Yeah. So positive finding done. Okay, and she will give you history. I said to you in the history, she might give you history of feeling what?
Burning.
Unwell. As risk factor, she'll tell us, doctor, I've been unwell for about a week, not myself, this time. Okay, so what is the management? Okay, there is something we need to agree on. Herpes simplex, herpes zoster, herpes labialis, any herpes, any what? Herpes. Susceptible people, immune compromised. Safety netting, immune compromised. Again, any herpes. Guys, I'm giving you things, wallahi, during the exam, under the pressure, only what I'm saying now that will stick to your mind. Believe me, and you will remember what I'm saying. The olive. Perfect. Wallah, بجد. The olive. That's the look. I have made my management notes. It's full. Look, you see, it's full. Look, can you see? This is management, full of management. But again, I know I have made this management note just because people said, well, we need management, doctor. Here you go, management. But show me how you will manage to say this in 8 minutes. You can't. So again, I have sensitivity myself. Whenever I see my new management notes, I tell myself this is not fair. I made it just to make people happy, but that's not the right way. The right way is the olive. You don't need to talk a lot. So whenever there is herpes labialis, herpes simplex, herpes zoster, shingles, always please, main risk factor in history is what? Immune compromised. Main risk factor in history is what? And always in management, tell him don't get in contact with who? Immune compromised. Online doctors, are you clear?
Yes.
So always remember.
Yes, doctor.
Always remember. In management, I will tell the patient avoid the immunocompromised. Who's the immunocompromised? Pregnant, old age, neonates. Clear? So this is the same. Management, Bismillah Rahman Rahim, avoid contact with pregnant, old age, and neonate. Okay? What if you don't tell him this? What's going to happen?
Fail.
No.
Error station.
Medical error station. Okay? So, but now I have told him about to avoid the immunocompromised. But what is the management here? Management? Some cream that they will put antiviral cream. And when they put the antiviral cream, okay, I will tell them don't rub it. Don't what? What's the thing of don't rub it? Don't rub, just dip it. So don't
Rub it,
just dip it. It's soothing, yeah. Don't rub it, just dip it. Don't do this. Don't do this. Just dip it, yeah. So don't rub it, dip it. Very important. So I will give antiviral cream. Okay. There are something called, this is what we call just cold sore. Yeah, that's what we call, what's called cold sore. Very common in UK, cold sore. So I will give you will give her cream, antiviral cream. Don't rub it, dip it, and you will give her patch that will non-sticky. It's not gonna be sticking, but will be covering the lesion. So it's called cold sore patch that will be put here and to cover the lesion. Okay, again, you can give her lidocaine. What is lidocaine? It's like anesthetic gel. If it's painful, okay, we'll make it numb, and advise to drink plenty of fluids, and advise, supportive. Okay, comment. Look, he's left everything and he's been talking about kissing. Look,
we're in the UK, it's very important.
Kissing is a safety netting, is not treatment.
Sure.
Does that make sense? Guys, always follow the structure. Always follow the structure. Kissing, is it treatment?
No.
Yani, when you tell well, one of the main point in management is kiss. You need to kiss. No, it's safety netting. Yeah, safety netting. So that's why I like to mention it later in safety netting. Okay. So always make your head in a chronological order. So first step in management, what to do?
Isolate from
Avoid who? Immunocompromised. Very important for me. Avoid immunocompromised. Always avoid. So it affects immunocompromised, and you advise them to avoid the immunocompromised. Okay. Anyway, then you will give what? Cream. Okay. Don't rub it. Dip it. You can put patch. If it's painful, you can put lidocaine. Okay. Okay. Now, do and don't. Do and don't. Things that you do, because think about it. Because it's in the lab, and sometimes they cannot what? Open. It's tingling, painful. They cannot open. So you ask them to eat small amount of food. Don't, because it will make it not heal. Okay. Eat cool, soft food. Okay. Always before you put the cream, what to do? Wash your hand, and after you put the cream, wash your hand. So wash your hand before and after you put the cream. Okay. And that they can take the painkiller and stuff. What things that you avoid? Things to avoid. Avoid sharing anything like forks, spoons. Okay. Avoid kissing anybody. Okay. And avoid oral sex. Okay. Avoid oral sex. You must talk about it, because oral sex can lead to having the cold sore in the genitals. Okay. So oral sex. So avoid oral sex, avoid kissing, and don't share things like towel. Don't share spoons, things. Okay. Online doctors clear.
Yes,
And if
doctor.
it's not resolving, come right away. Okay.
Yes, doctor.
Is it difficult or is it okay? Dermatology going good?
Yes, doctor. Perfect.
Beautiful.
Genital wart.
Yeah.
Genital wart. Genital wart. Okay. Genital wart. Again, I don't know anything about it. I came to the exam and I don't know anything about genital wart. Okay. I went to the exam and the patient told me, I have a lesion on my penis. How? It's fine. Lesion on your penis, it's okay. It's like lesion anywhere else. It's like what? Lesion anywhere else. Where is it, a brother? On my penis, a brother. Since when, a brother? A week ago, a brother. Anywhere else, a brother, you have the same lesion? No, a brother. What is the shape, a brother? What is the color, a brother? Any change in shape, a brother? Any change in color? Is it itchy, a brother? Is it painful, a brother? Is it bleeding, a brother? Any discharge, a brother? Any fever, a brother? And then after that, flows. And after that, concern. And after that, STI. You remember STI? What's STI? Sun. But you're not going to ask him about insect bite down there. You understand? So that will be, yeah, sonic exposure. You're not going to ask him about sonic exposure down there, yeah? Okay.
So STI, maybe we should ask about
Yeah.
STI.
But STI, yes. But STI, DESA plus or minus STI, yes. Okay. And I'm just walking you through the structure and reminding you how to follow. So in case you forget, okay. Now and then I will go to V2. Any medical condition, a brother? Have you had this lesion before, your brother? And then DESA. DESA, smoking, most important. Plus or minus STI, sexual history. Do you want to ask sexual history? 100% sexual history. And HIV drug abuse, yes. And then you will go to maftosa, same maftosa. Okay, and then you will go to examination. Okay, so genital wart, what is the process of finding? Okay, genital wart, the patient will tell you, doctor, I have some lesions that are painless. That are what? Painless. His main concern, it's painless. Doctor, it's causing disfiguring. It's embarrassing. It doesn't look nice on my penis. Okay, so that's how he's gonna tell you. All right, I'm bringing you the presenting complaint as you will hear it. Yeah, so painless, but it's what? It doesn't look nice. You know the shape that the figure is not nice, doctor, and it's embarrassing. Okay, then follow the structure as we said. Can you miss sexual history here?
No.
Can you miss sexual history? Can you believe it that people in the Mogdi forget sexual history? They do.
In genital warts.
Imagine. Why do you use the penis for?
Urination and sex.
Two things. Water and sex. Urine and sex. So how come? Erectile dysfunction station. A patient is coming erectile dysfunction. Again, they forget. UTI, for example. Guys, always. Penis is for sex and urine. Whenever you see anything, please, sex and urine, because it's not gonna be forgettable. We're not gonna forgive you for. It's not gonna be forgiven. We're not gonna forgive you if you forget to ask about water cycle, urine, and sexual history. Please, a must. Okay. So anyway, so this is the olive. So painless, embarrassing, and sexual history, and contact. Okay. So do you need to ask about the sexual history in details? The partner, does she have any symptoms?
Yeah. Why not?
Yes. Yeah. Okay. Now on examination, guys, يعني عذرا لبشاعة المنظر. On examination, this is the shape of it. This is how it is. On examination, this is how it is. Okay. All right. Management. Bismillah ar-Rahman ar-Rahim. Gum clinic. What? So what is step one in management? No. What is step one? We say referral. So step one is gum clinic. Sexual health clinic. Okay. Senior, symptomatic treatment. You will give him, first of all, the treatment is either cream or surgery or freezing. So cream, surgery, freezing. Okay. So what is the most common that we do? Freezing. Okay. So the most common that we do for wart, freezing. All right. But sometimes the treatment is repeated several times. Okay. Comes and it's repeated, freezing. Okay. Surgery, they can do laser as well, and they give cream. All right. So the cream, it's applied over the wart few times. Okay, few times for several weeks. Tell him that it's not gonna be a day, 2 days, 3 days. It's several weeks. So the first thing that you will start in managing this case is what? Guys, gum clinic, and this patient will have full STI screening. Okay, gum clinic, and this patient will have what? Full STI screening. First thing, I always in my management like to start with the important things. Always. So step 2, senior, and then the management will be, you can freeze, laser, surgical removal, and sometimes use some cream. Yeah. So start with cream, you can freeze it, laser, surgical removal. Okay. And with the laser, with the freezing? Is it one off, or it can be repeated few times? Repeated few times. And come back to the do and don't. Very important. Have I mentioned any case, online doctors, have I mentioned any case without do and don't?
No.
No.
So please, the NHS, they focus on this do and don't. Do and don't. Do and don't. Because if you give him medication, but you don't advise him do and don't, he's going to keep coming. Yeah. So do and don't. Do what? Avoid any perfumed soup. Avoid any perfumed shower gel. Okay. And if it's a female, wants to get pregnant, she should wait. Okay. Don't smoke. So smoking, again, it makes it worse. Okay. And again, what is the thing that you avoid?
Oral sex.
Oral sex. Oral sex. Okay. Oral sex and sexual activity, because it's a gum clinic kind of cases, it's genital warts. Okay. Now, general advice that you must give this patient. General advice that you must give this patient. Number one, your current, guys, online doctors, what is the first thing I mentioned in management?
Gum. Refer to the gum clinic.
الاخر. So this case is a gum clinic, sexual history, sexual STI screening, and even in management partner, it's sex all over the place. What? Sex all over the place. Always remember, if you forget, if you say laser, that's what people do. Yeah, what people do, they don't know the priority. They talk about laser and freezing. We're gonna freeze it, we're gonna put it in the freezer, we're gonna heat it, we're gonna, and then they forget completely that more important than this is talking about sexual history, more important than this is gum clinic referral, more important than this do and don't, kissing, oral sex. And here now, general advice that your partner must get tested. Your partner must also get tested. Okay. And you can stop the genital warts from getting passed to the partner by using condom. So avoid safe sex. Okay. Avoid safe sex. And don't share toys. Don't share toys, sexual toys. So sex, avoid sex, use condom, sexual toys, guys, very important. NHS management, they focus on these things a lot. Okay. So if I want to write one word next to genital wart, one word that will suit genital, whenever you revise before the exam, every station is one word. That's what I used to do when I was preparing for my plab 2. Every station is one word, sex. So this is station, word sex. That's it, right? Sex, the word sex, which means sexual history, ask about the partner, examination, genital, sex, management, sex, safety netting, sex. Okay, please. Next station. Guys, online doctors, I just want to tell you something. Yeah. Sometimes when I give lecture, yeah, because this happens all the time, very often. It happens with me very often, nearly after every lecture. Yeah. Sometimes I mention things to make your job easy, not that I am rude or I am dirty or I am, because I have messages sometimes when I give any mock, whenever I give any lecture, yeah, and people, they keep forgetting when I give them an erectile dysfunction station that appears in the exam all the time, yeah. And whenever I give them the station, they forget sexual history, they forget UTI, they forget. So I say, okay, why do you use the penis for this and that? These things, we are all doctors, right? We are all doctors. So when I say it, I'm trying to make your job easy. I'm not trying to be funny. All right, doctors? All right?
Yes.
When I say it, because I never stopped saying these things. I am trying to make your job easy. So in this station, for example, when I said to you, history, sex, sexual partner, examination, genitals, management, gum clinic, sexual STI, safety netting, sex, I'm not trying to be rude. You understand? I'm trying to make your job easy. And I said to you, right, but I keep getting messages after every lecture. I'm not gonna stop. You understand? That's my way. My way is making things easy. My way is giving you one word here, one word there to remember. And so I will never stop, and I'm sure you will never stop sending me messages. Seriously, people say haram. I know, guys. I know. But I'm a doctor. When I explain things, I'm a doctor. We are all doctors, right? So yes. But I keep getting the same messages, and I keep doing the same. And it's like Vicious said, they keep sending the messages. I keep doing the same. So
we will see this in real life, doctor.
Sorry.
We will see this in real life every day.
Yes. Seriously. Yes. You understand? So that's why, and for me, my main concern is making things easy. I want you to have easy life in remembering things. Next station is acne. Acne. You remember, what did I say to you about acne? I said acne, it's a female and psychosocial. You remember? A female psychosocial. Can you please write down next to the word acne 1, 2, 3, 4 words, and that's what I want you to remember. How many words? 4 words next to the word acne. So every station, guys, just a quick revision, just for what? Herpes labialis, okay? Herpes labialis and varicella zoster or shingles, and the chicken pox. I said to you, remember, it affect who?
Immunocompromised.
Safety netting who?
Immunocompromised.
We spoke about the herpes labialis, and we spoke about the genital wart. Always start to always mention sexual history management, sexual history and gum clinic, safety netting, sexual gum clinic. Now acne, write 4 words, and that's it. Very important case. 4 words. Number 1, psychosocial.
Mood.
Psychosocial. Yes, psychosocial impact. Psychosocial. Number 2, liver.
Pregnancy.
Liver. Number 3,
Pregnancy.
pregnancy. So liver, kidney, pregnancy. So psychosocial, liver, kidney, pregnancy. That's it. Again, what did you write, guys? Psychosocial and liver, kidney, pregnancy. Let's go to the next station. Let's move on, guys. Next station.
Move يا brother.
وين يا عم؟
Imagine. Move where? Move where? I'm thinking. Okay. So, guys,
What are you thinking about?
Sorry?
What are you thinking about?
What are you thinking about? So, 4 things to remember in this station: psychosocial, liver, pregnancy, kidney. And with pregnancy, right, in brackets, breastfeeding. So pregnancy, breastfeeding together. Liver, kidney, mood, psychosocial. Okay. Dr. Mo, why do you tell us remember these words? When you are taking history, you are an FY2 doctor, Julia Robert, 24 years old. Imagine Julia Robert has acne in her face. Is it fair?
No.
It's not fair. So a female coming, Julia Robert, acne on her face. That's her complaint. How can I help you, doctor? Acne on my face. Okay. Like any skin lesion, yeah? Doctor, I'm having spots. Where? Since when? Is it itchy? Any discharge? Is it painful? Any fever? Is fever a valid question?
Yes.
Because it can be infected and cause infection, fever. Same structure. However, I will always ask psychosocial impact. How is your mood? How is it affecting your life? This girl, Julia Robert. Who's Julia Robert? She's an actress. So she will tell you, I'm an actress, and this is affecting my look. This is affecting. She will tell you, actually, the patient that will come, it will be someone who's really affected by the way she looks. Okay? That's why I ask about the mood. If low mood, assess for suicide, harm. Okay? If low mood. So she will have low mood. That's the first keyword that I have mentioned to you, which is mood. Again, the first word, the keyword, which is mood. So I will follow the same structure. Presenting complaint, skin lesion. What to do the skin lesion? Explore, as I mentioned. But when you explore, as I mentioned, it's affecting her look. It's affecting her job. What will be her job? Actress, she's not happy. Cosmetic is not nice. Okay. So according to my structure, number one, presenting, complaint, explore. Then number two, concern. What is number two? Concern. She will be concerned about, she needs retinoids. She needs what? She needs tablets. She needs tablet form, okay, of retinoids, isotretinoin. She needs a medication. That's her main concern. If a patient, when I ask her about her concern, doctor, I'm asking for retinoids, isoretinoids, or I need, what is the first question I will ask? Why? How did you know about? Yeah, why and how did you know about it? Okay, and be careful because you need to ask her very important superficial logical question, which is, what did you do for it? What products have you been using? What things have you been using? Clear. Because she will tell you, I've been using such and such and such and such, it's not working. What if she has never used anything before? Can you take it as a chance for yourself? So in management, you try something else before the retinoid? Because it has plenty of side effects. You understand me, guys? Online doctors, do you know what I'm talking about?
Yes, doctor.
The patient will be concerned about a specific medication that has many side effects, which is retinoids. Okay? So make sure in the history you ask her, have you used any methods for the acne before? Because if she hasn't, you can start with other medication before you give her retinoids. Clear. But if she said yes, she will tell you, actress, she will tell you, I've done everything. I'm fed up. Then she will be asking for this medication, the isotretinoin or the retinoids. And for that, I will use the other three words. What are the other three words? I've said one, mood. What are the three? Liver, kidney,
Liver,
pregnancy.
kidney, pregnancy.
Which are the
Breastfeeding.
contraindication for this medication. That's it. Which are what? Contraindication for the medication she's asking for. That's why, how many words in history? 4. Mood, because she will be low mood. Liver, kidney, pregnancy, dash, breastfeeding, because this medication will be contraindication, and her main concern is asking for medication. So I need to ask about pregnancy, sexual. Don't say, are you pregnant? Are you pregnant? No. Are you sexually active? Yes, doctor. By any chance, do you use any method of contraception? By any chance, you need to get pregnant anytime soon? That's how you ask, yeah? And then you ask about medical condition, liver problem, kidney problem. If anything is positive, the medication is contraindicated. Online doctors, clear?
Yes.
That's why I said every station has 3-4 words. Don't forget also in this station to ask about the PCOS. Why PCOS? Why should I ask about PCOS?
Risk factor.
Risk factor for
Because it's a cause. Yes, it is a cause. Acne can be caused by, so you can ask her about the polycystic ovary. Like what? What are the questions that you can ask? Ask about her period. Yeah, because the period can be affected. Okay, ask about her period. Ask about any tummy pain, because cysts can cause tummy pain. So ask about her period. Ask about facial hair. So hair in abnormal places. Okay, so facial hair. Ask about BMI. Okay, so which something you will mention in examination. So in examination, you need to measure the BMI. So hair growth in, don't say in abnormal places, yeah, because abnormal will make hair, say unusual. Okay, so which is hirsutism, yeah, and period. So period, hirsutism, and weight gain. Okay, which is you are trying to find the cause for the acne. It's a cause for the acne. Okay, so we can recap this station actually in 5 words now. Number 1, mood. Number 2, liver. Number 3, kidney. Number 4, pregnancy dash. Number 5, PCOS. Station finished. Online doctors, clear?
Yes.
Yes.
Yeah. Mood, why? Because it will affect her mood. Kidney, liver, pregnancy. Why? Because she's asking for a medication that is contraindicated in these cases. PCOS. Why? Because it's one of the causes of acne. Easy peasy. Let's move. That's the history. But by the way, you will apply the history on the structure. So don't start like this. How can I help you? Doctor, I have acne. How is your mood? Because Dr. Mo said 5 words. So how is your mood? My mood is okay. Okay. Any liver problem? No, doctor. Any kidney problem? No, doctor. Are you pregnant? No, doctor. Any abnormal hair growth? No, doctor. Thank you very much. No. How can I help you? Doctor, I have spots. Explore P1. Where? Anywhere else. Since when? Shape, size, bleeding, discharge, painful, itchy, fever. Bomb, gone. Second, what's your main concern as the structure? The structure number 1, P1, yeah? Number 2, concern. What's your main concern? Doctor, I need a medication, isotretinoin, or I need isotretinoin or retinoid. Okay, this medication, why? How do you know about it? Have you tried anything else? She will tell you. Then go for the question. Well, definitely we can help you with that, but this medication, there are some questions that I need to ask to see if it's safe or not. Then ask about the liver, kidney, pregnancy, and then ask about the PCOS as a cause, as a factor. Then go for P2 medical condition and then finish the station. Do you need to ask in DESA smoking? DESA smoking?
Yes.
Of course, very important. Smoking is very important, okay? Okay. Now examination. You will say I will examine. You will be giving this picture. Yeah? You'll be given all of these pictures. Okay? Okay, so Wallah, mashallah. MashaAllah. What did you say? It's called what? Improvise. Doctors are improvising. Okay, on improvisation. Okay, that's in French. On the chat box. Soha. Yeah, Soha for VCOS. Okay, so yes. So management, guys, management. After examination, management. What does she want?
Medication.
What is the medication? The medication is what?
Retinoid.
Okay, there is tablets and there is cream. So retinoids, there is tablets and there is cream. Online doctors, can you hear me?
Yes, doctor.
Tablets and cream. Tablet form would be given by specialist only, dermatologist. Cream can be given in the GP clinic. Okay, so cream can be given in the GP clinic. However, even if the tablet will be prescribed and should be referred for it, you need to ask about contraindication, as I said. Okay, that's why we asked in history. So management number 1, according to the management steps. As I told you, the acne, if it's low mood, severe all over her face, severe on her face, affecting her mood, she has done everything and nothing is working, do you refer her for the tablets, for the capsule?
Yes.
Online
Yes.
doctors? Yes. So step 1, definitely we can refer you to the dermatologist who will prescribe you the tablets. Okay, she has never tried anything, she has never used anything, she has never used any product, and she wants the tablet. Do you advise her to use cream topical before tablets? Yes. Do you need to refer her? No. Clear, guys? Online doctors, clear?
Yes, doctor.
Yes.
We are not scripted here. If you open any scripts, they only give one scenario. That's why people fail, because they read the scenario and that's it. All the scenarios will be referred. No. Make sure you ask in the history. Have you used anything before? Have you tried anything? If no, never tried anything. then you can advise her by topical product. If yes, I tried everything, nothing is working, then step 1 will be referred to dermatologist for the tablets.
Yeah.
Clear? So step 1, I have mentioned 2 scenarios. Are you following me? Okay. So online doctors, are you lost with anything?
No, doctor.
Okay. So in this case, some investigations will be done. Online doctors, how many words I have mentioned when I said to you acne?
Crystal
I
clear.
said to you, write how many words?
4.
Five.
Liver and
Write how many
kidney.
words? Write 5
Five.
words. Right?
Look
Look at the
5
beauty.
words.
Look at the beauty
Yeah.
of these 5 words. So in history, you ask about 5 words. In history, you ask about the 5 words.
5.
And in investigation, Taha, 5 words. What do you mean? Take the mood out. So 5 words. Number 1, she will need to be assessed. Her mood needs to be assessed. Must be assessed. Any girl with acne who's not happy and mood must be assessed in management. I put it as investigation. Like I put investigation, 5 words. Number 1, what is number 1? Mood must be assessed. What is the second word? We said in the 5 words.
Kidney function test.
Kidney function test. What is the third word?
Liver function
Liver
test.
function test. What is the fourth word?
Pregnancy.
Pregnancy test.
Pregnancy.
What is the 5th word?
Hormonal test.
So
PCO.
FSH, LH needs to be measured to see PCOS, and ultrasound as well. Ultrasound, because it could be a part of. Yeah. Clear, guys, or you lost? Or
Yes.
Clear, doctor. Yeah.
that's it. So 5 words everywhere. Whenever I ask anyone, tell me about the acne before the exam if you are revising. And by the way, this is how I made all my online lectures in the new course. It's all like this. Boom, 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 move on. Boom, 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 move on. That's what you want. You don't need the first course, the boring one, the long one. This is, you say for 5 days you finish it. 5 days, 6 hours a day, 7 hours a day, you finish it while you are cooking,
Doctor.
or you are looking after the
Doctor.
kids. Anyway, so yes.
Sorry. Can you send us the link for your group, WhatsApp group?
We don't have WhatsApp. What do you mean WhatsApp group? The WhatsApp group is only for the doctors registered in the course.
Oh, so you don't have like a Telegram group that we follow you on and your
No, we have a
sessions?
Facebook group, doctor.
Okay. So I can find you on Facebook.
Look, I'll send you the link now. Okay.
Yeah, please. Thank you so much.
I will send it on the chat box. I'm sure they all. Okay. Anyway, so what did we say? We said 4 words, 5 words. Okay. We said 5 words in my investigation. So don't forget, because when people mention investigations, they always forget what I've mentioned. Always. Yani, seriously, if you study the whole curriculum, big curriculum, yeah, would you really remember going to the exam with mentioning pregnancy, FSH, LH, the ultrasound? You will forget. So study that way, okay? Study that way. Now, coming back to the treatment. How would you treat? We said number 1, don't be lost. What is number 1 management? Dermatology referral if what?
If
She tried everything, we can refer her to the dermatology.
Yes, dermatology referral if she used everything and she's severe, I'm not happy. However, cream F and no referral. F.
She not tried anything.
Okay. Number 2, I've mentioned investigation. Senior and then investigation. Investigation we've mentioned. Okay. Number 4. Okay. You must talk to her about the side effect of the cream she will have. The what? The side effect of the cream. This cream, guys, causes what? Dry skin. What else? It makes the skin stretch. As if the skin is stretched. Sorry?
of the skin,
Thinning of
sun
the skin.
sensitivity, sun sensitivity.
Yes, guys, it makes the skin. Number one, stretch the skin. It causes some itchiness and sensitivity for the skin. When you have it, the skin starts as if it's stretching. These are side effects for the cream that you will give. You must talk about the side effects. Okay? Okay. Now, forget about all what I've mentioned. Forget about all what I've mentioned. And let's talk business. What do you mean let's talk business? What do you mean let's talk business? Okay. Okay. What do you mean let's talk business? Let's talk business because I will be giving you now things that they have mentioned in the NHS, and I don't know if you have heard about this or not. If you watch the long course, you've heard it already. Okay. You wanna talk to her about if she's obese and if she has unhealthy lifestyle, like what? So we have spoken about the medical part of treatment. We have spoken about medical part, and I said to you the NHS always focuses on the non-medical. The non-medical that you advise her, if she smokes, stop smoking. If she drinks plenty of alcohol, decrease. You advise her to do plenty of exercise. Why? Because it put her in a good mood. Yeah, put her in a good mood. And diet, healthy diet. So advice about DASA. You remember the structure. What is my structure in management? Step 1, refer. We spoke about it. Either refer or not. Step 2, senior. Spoke about it. Step 3, investigation. We spoke about it, which is the 5 words. Step 4, symptomatic and lifestyle. Symptomatic, which the medication we give, and we spoke about the side effect. Lifestyle is DASA. You must talk about DASA. You must advise about DASA. Okay, very important. Okay. Listen carefully. Listen carefully. Step 5 is referral to specialist. You know the structure. What is the last step in management? Safety netting. Safety netting. This lady, I will advise her if she is sexually active to do what?
Two types of
Pregnancy
contraception.
protection.
Guys, pregnancy test. Pregnancy test before she starts. Write down these golden words. Write down. It's in the notes, yeah? But because the notes is like, management notes is like plenty of words, I'm giving you the olive. The olive. Just take the olive and the notes quick. You don't need everything in the notes.
Teratogenic.
Number 1, safety netting. We will do pregnancy test and liver test and kidney test before we give you the medication. So pregnancy test before the medication. Okay. Number 2, you will use double contraception. What? You will use what?
Double contraception.
What do you mean double contraception, doctor? Oral and condom.
Yes.
Double contraception. Number 3. That's all. That's with every patient who will be on the tablets. That's what we're gonna do. We're gonna do pregnancy test before, and she's gonna use pregnancy test before the pill, the tablet. And when she start taking it, double contraception. And every month, pregnancy test. Every month what? Pregnancy test. And we will give her monthly supply. We'll give her what? Monthly supply of the tablets. Only monthly supply. We're not gonna give her 2-3 months. Why? To come to me every month. The pregnancy test every month. And her mood will be assessed. That's not what I'm saying. That's what the NHS said. Her mood should be assessed all the time. Guys, let's move to the second station. Not the second, the one after this. I think, guys, I'm really sorry. I cannot take any questions because the session is recorded for the new course, and I want to avoid the interruption that happened in the first course. I'm really sorry. I'm not trying to be rude. I'm not trying to be horrible, But the reason why I'm recording this course is number one, to be updated. Number two, to avoid the disturbance. That's why if I allow anybody to ask a question, I will allow everyone, yeah? And I just want it to be quick, okay?
No worries.
I'm sorry, guys. I'm really sorry. I'm really sorry. But this is one of the things I'm recording the course for the interruption, okay? If I allow anyone, everybody will ask and it will be, you know. So, but you feel free to ask questions right after we finish. I will stop recording and then you can ask. Anyway, so teratogenic. People are saying it's a teratogenic. We have been talking for half an hour about pregnancy test to stop pregnancy with double contraception before, because it's teratogenic. Okay. Fungal infection, ringworm. Next station. Any problems in acne? Because doctors complain about acne all the time. Doctors all the time. Dr. Mo, the acne station. Dr. Mo, the acne station. Any problems?
All good.
All good? Focused or am I taking longer? It's not taking long. Focused. Fungal infection. Oh, sorry. Don't forget to give her advice about the sun. Don't forget to give her advice that the towel, yeah, the towel when she's drying. Don't forget to tell her to avoid frequently washing the face. Sometimes they frequently wash the face, frequent. Why? Because they think that it will clean it. Avoid frequently washing your face. Avoid frequently washing it. When you wash it, avoid that, or use fragrance-free, which means product. What is fragrance-free product? Product that does not have any smell and things, yeah, because it irritates the skin. Okay. Fungal infection, ringworm. You are an FY to doctor in the GP clinic. George Smith, 45 years old, has come with a concern. Talk to him, address his concern. This is the ringworm fungal infection. Okay. Guys, I can see plenty of things about teratogenic. Which medication is teratogenic? What is the teratogenic? Okay, fungal infection, ringworm, very common question. Okay, as we used to, what is the olive? Yeah, what is that olive? What are the words? 3-4 words to remember in this station. You remember the herbs, okay? It affect who? And the safety net for who? Write down. So write down, immunocompromised. Right, by that I mean elderly, pregnant, newborn, neonates, and people who are on medication like steroid stuff. So number one, and in fact, every scenario fungal infection, ringworm, it will be a patient who's immunocompromised. So this is number one word you write down. Number two, that's in history. So in history, the patient will be immunocompromised. Okay. Number two word, the second word. The second word in fungal infection, contact history. The third word, skin scraping. Skin scraping. The fourth word, antifungal medication. So how many words we wrote? That's all the station for you. This is all the station. What do you mean this is all the station? We wrote 4 points in antifungal in fungal infection, ringworm. We wrote number one, it affects who? Immunocompromised. So make sure in the history you ask about medical conditions. If the patient is immunocompromised, rheumatoid on medication, ankylosing on medication, using steroids, because it affects the fungal. It's fungal. It affects the immunocompromised. Number 2, I said immunocompromised. So it is what? Pregnant, neonate, elderly. Number 2, I said contact history. By that I mean, so you need to ask who's at home, who's this patient in contact with, because you will manage contact later. Clear? You will manage contact. It's contagious. Number 3, the third point, scrapping, which is investigation. So you're not going to take biopsy. You're not going to do anything. Investigations are scrapping, skin scrapping. Finally, management, antifungal cream. And don't forget that in management, I will speak about contact as well. I told you contact. Did you write contact in the words? So how many words is right? Online doctors, can you tell me the olive? Can you tell me the olive? One doctor can tell me the olive.
Okay. Immunocompromised, contact history.
Yes, Dr. Nihal, immunocompromised. By that I mean, what groups?
Contact history.
No, by that I mean what
older
groups?
people, pregnant ladies, pregnant ladies, newborn, and the people who are on steroids.
Okay, second point.
Contact history.
By that I mean, I will ask about?
If there is anyone they came in contact with who having the
and
same
by that I mean, in management,
lesion.
how is it going to help me in management? How is it going to help me in management?
Avoid being around immunocompromised people.
Avoid contact. It's contact, yeah. Third point.
Skin scraping.
Fourth point.
Antifungal medication in form of creams.
Antifungal medication. Let's start the station. Yalla, let's start. So, you are an FYC doctor, George Smith, 45, come with a concern. How can I help you? Doctor, I have round circular area of skin lesion. How to explore it? Follow my structure. This is the presenting complaint. Where exactly? In my arms, in my leg, whatever. Since when? Doctor, 2 months, 1 month, 1 week, 2 days, 1 day, few hours. Anywhere else in the body? Shape, any change in shape? Color, any change in color? Size, any change in size? Is it itchy? Is it painful? Any bleeding? Any discharge? Online doctors, are you lost? I'm applying the finding on my structure that I have mentioned, and I said to you, I took my time in the structure, but it will make your life easy. Are you lost? Should we move? The second point after the P1 is what? Concern. I will ask the patient to concern. The third point is STI. What is the third point? Flows and STI. Flows and STI. One of the online doctors will tell me, what do I mean by flows?
Fever, loss of weight, loss of appetite.
Okay, then what do I mean by the fourth point, STI?
Sun exposure.
Insect bite, trauma.
Perfect.
Trauma and insect bite.
Is it valid? Is it valid to ask a patient with lesion on his arm about sun exposure, insect bite, trauma?
Yes.
Perfect. Then P2, medical condition. Have you had this before? That's the first question. What is the second question in P2?
Do you have any medical conditions?
Okay, is any medical condition valid question or not? Is it one of the 4 questions I gave you?
Of course, because
yes, because they will affect immunocompromised. Yes. Then when I go to B3 DESA, in DESA, is smoking important? Very important. Very important.
Of course.
In MAFTOSA, medication, is medication important? Yes, because patient on steroid, immunocompromised, yes. Allergy, is allergy important? Skin lesion? Is allergy important? The skin lesion is itchy. Yes, allergy. Family history, yes. And then travel and contact. Is contact important?
Yes.
Have I mentioned the contact in the words, the magic words, the olive words?
Yeah.
Yes, we mentioned the contact there. Okay. Then occupation. Is occupation important?
Yes.
Yes, because you're gonna give him sick note.
Yes.
He's not gonna go to work. Does anybody has a power bank? Yeah, if you don't mind. Anyway, so then I will move into examination, and when you examine, this will be given. Can you see, guys? This will be given when you examine. Okay. Then after examination, you will talk about management. In management, number one, senior. Number two, symptomatic treatment. Symptomatic treatment. Antifungal cream. Antifungal cream for 4 weeks. Antifungal cream, and the treatment sometimes lasts for 4 weeks. Antifungal cream, antifungal spray, antifungal gel. Few forms you can use: cream, gel, spray. Okay. 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 So what is the form of antifungal?
Clotrimers.
Cream,
Cream, gel, spray,
spray.
foams.
Is there antifungal tablet?
Yes.
Yes,
Yes.
but we give it if it's widespread, systemic. Yeah, if it's widespread. But if it's only on the skin, on the leg, one lesion, you give cream, you give yeah. So we don't give tablet unless, okay, we don't give tablet unless it's widespread, it's severe. Clear, guys?
Yes, doctor.
Yes.
And I told you the NHS, they focus on do and don't. On what?
Do and don't.
Do and don't. Type. Do, we know do. We know do. What is do? You remember in the, what are the magic words? The magic words, one of them is contact. So do, wash your clothes, wash the towel, don't share towels, wash the bed sheets, don't share bed sheets, don't share any underwear. Yeah, do and don't. So don't is the don't share things, okay? And do, what is do? What is do? Both of them are similar, you know. So it's so stupid. Do and don't always all the same, similar. Yeah. So thing is that you will advise this patient, okay, that if the patient is smoking, is it important to advise about smoking lifestyle? Yes. And sharing towel, sharing bed sheets, okay, and contact. You remember number one? What is number 1 point? Pregnant, immunocompromised, neonate. So if you use the magic words, it is everything. It is everything. The magic words, these 4 words, with any station in plab 2, write the 4 or 5 words, and this is the station, okay? If it's not improving, if it's not getting treated, if it's not improving, then dermatologist can do skin. What is the investigation? Magic word?
Scraping.
Skin scraping.
Scraping.
Skin scraping, okay? Okay. So you remember the contact, the people who are pregnant, yeah? This patient will tell you, my wife is pregnant. Can I get in contact with her? No.
No.
Avoid contact. Okay? That's a concern. That is a concern. Avoid contact. Yeah? Bismillah ar-Rahman ar-Rahim. Okay? Mole and melanoma. Mole and melanoma. Okay? So let's talk about mole. Guys, are you lost? We're nearly finished. We are nearly finished. We have mole, we have melanoma, and as far as I'm concerned, that's and seborrheic keratosis. Small melanoma, seborrheic keratosis. That's it. Mole, melanoma, seborrheic keratosis. Mole and melanoma, very easy. Mole and melanoma, very easy. Very easy. Because they are the opposite. Mole and melanoma are the opposite. Yeah. One of the doctors said, what is do? Do in the point of that we've mentioned. I said do and don't all the opposite. So do, start the medication as early as you can. Do, if you have a pet, if you have an animal at home, take it to the vet so they can get, you know, treatment. That's it. Okay. Anyway, so the mole. Salah al Nabi. How can I help you? It will be always a female. It will be always a female. Write down. 25 years old. Alicia Keys, not one key. Keys, yeah? Alicia Keys, 25 years old. Alicia Keys presented to the GP clinic with a concern. Okay. You remember the start of our lecture. I said to you it's very important to ask about mood. And I said to you in skin lesion, psychosocial. And I said to you, they always bring female because she is worried about her lock. Do you remember this or no? Same. How can I help you? Doctor, I have a mole in my shoulder and I'm having a wedding. And I'm really embarrassed. And I will not be able to wear my wedding. So what is the presenting complaint? Mole. So what is the structure? What is the structure? Since when? What made you come now? Since when? 10 years, 15 years. I came now because I'm having wedding. Second question in presenting complaint. Site, shoulder. Anywhere else? Third question. Shape, change in shape. Size, change in size. Color, change in color. Is it itchy? Is it painful? Any bleeding? Any discharge? Any fever? I am discussing what? What is the station I'm talking about, online doctors? Mole.
Mole.
Everything is negative. Done. Everything is negative. Everything is negative. Clear. Clear. Everything is negative. She will tell you it's small, doctor, pink, no changes, no increase in size, not itchy, no painful, no discharge, no bleeding, no fever. What is the second question after the presenting complaint? People who wrote the structure well. What is the second question?
Concern.
Concern. Her concern is her wedding. She wants to have her wedding and it's just, affecting her lock. What is the third? Whenever the patient say to you, my concern is I'm not happy about it, cosmetic and things, always ask about the mood. Ask about the mood. Her mood is okay. Her mood is, it's fine. Step 3. What is the step 3? Flows. No fever, no weight loss. Okay. Even if you are suspecting a mole, do you need to ask about weight loss? Online doctors, even if you are suspecting the mole, very important. Very important. Ask about flows. After flows, what comes after flows?
STI.
STI. She's having her wedding, ya brother. Can you ask her about STI? She's having her wedding. Can you ask? Is it ethical to ask her about STI?
Yes.
Yes, it's ethical because STI is not STI. STI is
Yes.
sun
Exposure, trauma,
exposure,
insect bite.
trauma, insect bite. And after that, go to P2. After that, go to P2, medical condition, and then quickly run through DESA. Quickly run through quickly. When I said quickly, why quickly? A patient is coming with a mole. Is it important? How is your diet? It's not important. The only thing that you need to ask about smoking. Okay? Smoking. Okay? So diet is not important. Exercise is not important. Smoking is a must. Okay? Then maftosa, quickly, again, medication, allergy, family history of what? Skin cancer.
Skin
Okay?
cancer.
But please, when you ask about family history of skin cancer, don't ask anybody in the family with cancer because it's alarming. It's what?
Alarming.
So always, I'd like to ask you a question. It may sound alarming, but it's a part of my consultation. Signpost. Then ask about skin cancer. Clear? Then when you examine, you will be giving this. Okay? Then what is the management? What is the management? The management, the assurance. When she say to you, doctor, I need the mole to be removed. I need the mole to be removed. Okay? Because I'm not happy with the way it looks. Does the NHS cover the cost for removal of the mole? No, it doesn't. So, but please, when you say to her it doesn't, say it. When you say to her it doesn't, say it in a way, well, we don't cover, we don't cover that. I'm really sorry to come across that way, but it's not covered by the NHS. However, if you need to go private, definitely you can refer you and it can be removed. But what if a patient comes to you with a mole? Guys, is it covered by the NHS for cosmetic reason?
No,
No.
doctor.
No. But look at the beauty of, I love when people follow the script. I love when people follow the script. It's not that I love it, but it makes our doctors have very high chance of passing because everybody else follow the script. So if we change this station into a mole, because I always train you on active listening. What is active listening? Listen carefully to the patient. Yeah, I always say to you, follow your patient. What if the patient said to you, doctor, it's sticking in my clothes all the time, it's irritating, it's always painful when I'm putting my clothes, it's just like irritating under the clothes, and it's causing me some disturbance when I put it. Or if the patient said to you, doctor, I feel very low, I feel very ugly, I feel that nobody wants to come near me, I feel that I have bad relationships, my boyfriends, they leave me all the time because of this, it puts them off. Can you remove it? Yes, you can. Does she
Yes,
have
we
to
can.
pay? Does she have to pay? No, she doesn't. It will be removed. So I hope you understood what I mean. Guys, did you understand what I mean?
Yes, doctor.
Yes.
Yes. And in this case, she can ask you. She can
Yes,
tell you,
doctor.
all right, doctor, what are the options for removal? How do you remove it? How do you remove it? The options. She can ask you questions random. Even if if you say to her private, you can say, yeah, I'm happy with that. But how will they remove it? How can they remove it? How can they remove it?
Surgically.
Surgically. Is that gonna be your answer?
There are there are many procedures which would be
Yes.
like
So
more.
we can put this patient in the oven, or we can put her in the freezer. Okay. So that's one option. We're gonna put you in the oven, so heat. We're gonna put you in the freezer, freezing, and shaving. Okay. So shave, they can shave it. Freezing, they can freeze it, and cauterization. Yeah. Clear? Okay. Finally, is safety netting. Doctors, are you lost?
No, doctor.
Okay.
What's heat, please?
Sorry.
What's the heat?
What is what?
The heat you talked about. What exactly is that?
The heat.
Yes.
No, I was saying we're gonna put her in the oven, which is cauterization, or we're gonna put her on the freezer, which is freezing,
Okay.
or laser, or shave.
Okay.
These are
Thank you.
the if she asks you and if she tells you, yeah, like how can you remove it? So you tell her many ways of removing it. It could be shaved. We're gonna refer you to dermatologist for this. Shave, like surgical removal, or sometimes with freezing, okay, or sometimes they cryo. Don't say that when I say to you, we can freeze this small and it can be removed, okay, or cryo, or so you don't tell her cryo, you don't tell her cartilage, you don't tell her, you say it as simple as you can. Yeah, we put something on it to be frozen, gonna feel it, we're gonna take it off. Shaving, surgical removal. You don't say to her cryotherapy, doctor, do I have cancer? Because of cryo, so be simple. Okay, now, so these are the steps: shaving, cauterization, freezing with liquid nitrogen, and laser. Okay, now safety netting, last step.
ABCD.
That's it. You remember the structure I said to you, the benign lesion, safety net, ABCD. What's ABCDE? A, asymmetry, change. B, border. D, discharge or diameter. C, color.
Color.
D, discharge
Discharge.
diameter. Okay, and finally E is exposure to the sun. Now coming back to the melanoma. The melanoma. I should not say melanoma, actually. I should not talk about it. Why? Because it's the opposite of mole. How can I help you? Doctor, I have a skin lesion. What is the structure? What is the step 1 in the structure?
Size.
Where? Doctor, behind my ear, doctor, on my shoulder, whatever. Anywhere else? No. Shape. Any change in shape? Yes. Color. Dark, black. Any change in color? Yes. Is it bleeding? Yes. Is it itchy? Yes. Is it painful? Yes. Any discharge? So everything is positive. Online doctors, are you lost?
No.
No, doctor.
So everything is positive. So she will have skin lesion, getting bigger, changing in shape, changing in size, getting changing in color, black color, itchy, everything. Okay. Now, when you go to concern, I'm worried about cancer. Why are you worried about cancer? Because my dad died of skin cancer, for example. Then when you go to flows, positive or negative? Flows, positive flows. Flows is the cancer symptoms. Cancer, you know. Okay. Then when you go to STI,
Positive.
STI is important. Yes, sun exposure. Yes, sun exposure. Everything. Okay. Then you go to medical condition. Then carry on with the structure. Smoking is positive, and carry on with the structure. Clear? Then when you say I need to examine, that is the picture that will be given. Can you see? Okay. Then when you talk about management, step 1 is
Referral.
urgent referral to dermatologist within 2 weeks. Okay. Doctor, what's gonna happen? What's gonna happen? The referral. Oh, sorry. Before management, provisional diagnosis. I think I have taken half an hour explaining to you how to talk about provisional diagnosis. Can you remember? Do you remember, guys? I have spent half an hour telling you provisional diagnosis. Is it cancer or best case, worst case?
Yes, best case, worst case.
Best case, worst case. And when you give her best case, worst case, don't forget to mention the positive finding on which you are building your provisional diagnosis. I want you, today I have 120 doctors listening to the online session. I want you to go and see, practice with people and see, do they mention positive or not? Nobody does. Nobody. Wallahi, nobody does. And you try to mention it, you will look exotic. You will look different. You will look good. Yeah. So when you manage, urgent referral to dermatologist, urgent referral to dermatologist. Okay. And you say to her that the dermatologist will do investigation. What is the most important investigation?
Biopsy.
Biopsy. They will take a sample. But from now till you get seen by the dermatologist, what do you want to tell her?
Safety netting.
Perfect. So metastasis, are you gonna safety net her about if there is any changes in color, in size? No, because there are already changes in color, in size, in shape, discharge. You will safety net her if there is any lumps anywhere in the body, if you have any skin lesion in the body, and don't forget to safety net about sun. You should avoid sun exposure. Finally, seborrheic keratosis. Seborrheic keratosis. The last station today, seborrheic keratosis. How can I help you? So, you are an FY2 doctor in the GP clinic. 70 years old. What's her name? Her name is Nancy. Can you believe 70 years old Nancy? Imagine her granddaughters. What will be the names? I don't know. Nancy, 70 years old. So 70 years old Nancy, I started to lose my energy. Getting tired about good job. It's the last station. So 70 years old Nancy, this is a phone consultation. This is what? And any skin lesion can come as a phone consultation. Dr. Mubat, if it comes as a phone consultation, how would they give us the picture? They always tell you the picture is emailed. The picture was emailed to you, and the picture you find in the cubicle. Clear? Again, skin lesion, dermatology can come as a phone. How to approach the patient over the phone, everybody knows. Everybody knows the approach of a phone consultation. I'm not going to repeat it here. Go to the new online course and watch phone consultation approach. Then you start taking history. Normal history or any change in history? Normal. And then in examination, you will have a picture. And it will be written that the picture was emailed to you. Doctor, do I need to open my email in the exam? No. The picture will be on the table inside. Okay? So how can I help you? She will tell you, doctor, I have a skin lesion. I have a skin lesion that looks like a wart. She will tell you. It looks like wart, doctor. Okay? Where is it? Doctor, in front of my ears. Here, doctor. In front of my ears, doctor. And it's not looking good. It's not looking good. I don't like it. It's been there for a while. I'm giving you the positive again. So the positive. How can I help you, doctor? I have skin lesion that looks like wart. How do you explore it? Structure. 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 Any of the online doctors wants to tell me how to explore it, so I'm making sure that you follow the structure.
Site, size, shape, color.
Perfect. Site, size, but site change anywhere else. Shape, change in shape. Color, change in color. Is it itchy? Is it painful? Any bleeding? Any discharge? And the description will be in front of my ear. Looks like wart, dark in color. Okay. These are the positive findings. What is the second step? Second step in the history? Concern. I'm really worried, doctor. Yeah, I'm worried in case it's something sinister. Why are you worried? Because my mom or my dad or anybody, she gives you any story. It's fine. What's it, step 3?
Close.
Close. What's the step 4?
STI.
All of them. And then go to medical history, P2, then in P3 only smoking, and same structure. And when you ask about a picture, this is the picture. Can you see, guys?
Yes, doctor.
This is the picture. Okay. Anyway, this is the picture now. Management. Okay. Before management, after examination, if you want to tell her provisional diagnosis, what is your diagnosis? How would you say? How would you say seborrheic keratosis? Is it cancerous?
Benign.
Perfect. So it's non-cancerous, benign growth, okay, in the skin. It is warty-like. It looks like wart, but sometimes bigger in size. Usually doesn't need any treatment. This is how you will give it to her as a professional diagnosis. Okay? Okay. Now, what is the management?
Yeah, sure.
Management depends. What if it's not causing any problem? It's not causing any pain. It's not causing any discomfort. It's causing nothing. What is the management? The assurance. The assurance. We're gonna leave it alone. There is nothing. We're gonna leave it without treatment. Without treatment. Okay? Okay, so what if they change the scenario and they give you a patient? Guys, are you lost yet? Are you lost? So I've given you the first scenario. What is the first scenario? Not affecting anything. Not affecting anything, nothing. No painful, no itchy, nothing, you know. It's just doctor, you know, the lock and not been there for a while, no changes. What if they give you another scenario? Okay, that it's itchy, it's interfering with my clothes, it's interfering with my jewelry, things like this. Does it need to be removed?
Yes.
Yes, it will be removed. Okay, it will be removed. All right. How do we remove it? We're gonna put her in the oven. We're gonna put her in the freezer. We're gonna put it in sun. So liquid nitrogen freezing, or cryotherapy, heat, or surgical removal. Okay. And what is the safety netting?
A, B, C, D.
Is it benign or malignant? Which way? Benign.
It's benign.
So A, B, C, D, E. Any change? A, asymmetry. B, bleeding. C, color. D, diameter and discharge. E is exposure to the sun. Dermatology is finished. We have covered all the stations of dermatology. We have given you the structure. Okay, there are 3 more stations that are not common. They came only once. I have put them there. Okay, so you can read them. Okay, in fact, there is one more case I can give. Okay, I put eczema is there. Okay, which you can read it, and impetigo. And what? Impetigo. Okay, you can read them. Okay, but there is one station that is very common, I must say. Okay, we need to give it, which is hemangioma. Okay, that's very important. And then that's it. Yeah? Hemangioma. So hemangioma, and then there's 2 stations that not really common, but read them. Impetigo and okay. So hemangioma. Hemangioma again is a phone consultation. Okay, same phone consultation. A mother who is ringing you because of her Emily. Okay, Emily. She is few months old, and her mom is ringing because she's concerned about her. Again, any phone consultation, what is the approach at first? Phone consultation approach. What is the phone consultation approach? You know how to ask if there's any patient ringing you over the phone, how to approach individuals. Okay, it's a phone consultation approach. Confirm address, confirm name, date of birth, and then make sure that she's not driving. The question that we know. Then how can I help you? Doctor, there is a lesion that is in my daughter's skin that appeared right after birth. Okay, there is a lesion on my daughter's skin that appears right after birth. What to do? Explore. Since when exactly? Where? Anywhere else? Shape, change in shape, color, change in color. Is it painful? Is the baby crying? Okay, is the baby not uncomfortable having this lesion? Okay, do you feel that it's making her uncomfortable? Questions that I'm asking about pain and itchiness. That's why I say uncomfortable, and is the baby crying, because you can know if it's painful or not from the baby, crying or not. Baby's itchy. With babies. Avoid the question they ask to adult, because with babies you cannot say is she shy from light? Well, is she have neck stiffness? No, you ask in a different way. If you want to exclude meningitis in a baby, you say when you carry her, is she in pain, which is neck stiffness, things like this. Yeah, so be careful from the way you ask. Okay, because you are asking here about neonate, about a baby who's a few months old. Okay, so the findings are the positive finding. She will tell you it's raised red lump, appear soon after birth, and it's getting bigger. It got bigger. Okay, that's it. These are the positive findings. That's it. Soon after birth, red lump, and raised over the skin, and it went a bit bigger. Everything else is negative. That's it. Do you want to exclude fever, meningitis, everything? Yes, you must exclude meningitis. You must ask about fever. Everything is negative. Everything is negative. Then when she's over the phone, they tell you on the question that the picture has been emailed. Then you see the picture inside. This is the picture. Land doctors, can you see?
Yes, doctor.
Yes, doctor.
Yes. Okay. Be careful because it's a new need. It's like few months old, whatever. So be careful. Don't ask about smoking and alcohol. Yeah, you might forget because you are talking to an adult. You might think, yeah, it is an adult. No. Okay. So some doctors do forget under stress. Yeah. Okay. The management simply reassurance. The management is reassurance. The management is reassurance. Okay. And again, because the child can scratch, so nails, gloves, but make sure you reassure the mother and make sure you safety net, okay? And there is a very important point here that if the hemangioma is around, but it's never appeared before around the eye here, yeah, but if it did, she will need surgical or she will need ophthalmology referral. Okay, be careful. It's never come, but just in case, never come. So if she gives you this, online doctors, can you see?
Yes, doctor.
Yes, doctor.
Yes, doctor.
So this picture, reassurance.
Yes, doctor.
This picture, what does it need?
Referral of ophthalmology
Ophthalmology
surgery.
Yeah, she needs to be seen. Yeah, she needs to be seen because you want to see if there's anything, any involvement. Yeah, but in the back, in the shoulder, anywhere, it's okay. But here, not okay. That's in the NHS. Okay. What about the sun? Do you know advice about the sun? Sun exposure? Yes. Any skin lesion, sun exposure. Okay. So is this case a case of reassurance or what type of case is it? Hemangioma. Reassurance, please reassure the mother. Okay. Guys, thank you very much. Have a lovely night, and inshallah I will see you soon.
Thank you, Dr. Mo.
Thank you, guys.
doctor.
And, we have in our online mock session for the doctors, inshallah, on Sunday. Okay, and I made it up for you. Yeah, today is Sunday. Yeah, we made it up now. So today is Sunday, and we had like 3 hours. So how long? 3 hours. Yeah, 6:30.
Doctor, we cannot go away without your weekly injection. You know?
Really?
أرجوك اديني الجرعة.
والله guys, and I do miss you. والله العظيم. I do miss everybody in the academy and online. I cannot just pass 1 week without seeing you. Yes.
Dr. Will you make a short video for ENT